They all look horrific, don't they? Their fur is in patches and tatty or even non-existent.
Oh my God. This poor thing, what happened to her?
Hi, sweetheart.
We have virtually no history on this dog whatsoever, so we have to piece it together ourselves. So you're going to do a full exam for me, tell me all the issues that you find, and how best we're going to treat them. So I've just had a call from Sonia, who's one of the incredible people that work for one of my favourite charities, All Dogs Matter. They help to rescue and rehome abandoned dogs here in London. And they've just let me know of 4 dogs that have just come into their shelter that are in a really terrible state.
Hi, Scott. How are you?
Yeah, I'm good. How are you?
I'm good. Thank you.
So here you've got a full house, 4
Yes,
dogs?
we've got 4 little dogs. We've
Wow.
got 2 Pomeranians, we've got Dalmatian,
Wow.
and we've got Jack Russell, all with really bad skin conditions. So if you could have a look at them all.
Absolutely, lead the way.
Hello.
Hello, you 4. Oh, you're a motley crew. Hello, pups.
Hi, baby.
Hello, you.
So they were all found together.
Right.
They were found in a lady's garden.
Hello, you. And my first impressions are these dogs are clearly neglected.
They're just in an awful way.
They're all quite thin, but what really strikes me is that they've all got skin problems and there's masses of hair lost. They all look horrific, don't they? Their fur is in patches and tatty or even non-existent. I'm a little bit worried about this little Pom though. I do think we need to have a little look at her and see what's going on.
Hey, come
on. Hello everyone. It was very clear from the get-go that the Pomeranian was the one that was struggling the most.
Hello you, can I see you?
She's the one that's lost the most amount of fur. She looks in the worst condition. She's very thin. She's struggling. You can see, well, clearly the biggest problem here is her skin and the complete lack of hair. So this has been going on for a while. She's lost a huge amount of fur as a result. Who would let their dog turn into this?
Get into
I mean,
this
it's
state.
disgusting. It really shocks me to the core, and to see a Pomeranian look like that, I just don't know how the people here do it, and I don't know how their hearts don't break every day.
She's also coming pregnant.
Oh, you're joking.
So, yeah.
And what happened to the puppy?
The puppy didn't survive. The puppy wasn't even a proper pup, so it wasn't even fully formed. And so,
Sickening,
yeah.
isn't it? Really upsets you, doesn't it, to see this?
It's heartbreaking. Everyone gets upset. You can't help it. You wouldn't be human if you didn't get upset about something like that. Sorry.
You're okay, we're going to sort you out. Hey, don't we? We'll sort you out. Hey. It's all right. Oh, hello. Hello.
Hey!
Wow,
hello.
they're affectionate little ones, aren't they? It's incredible, isn't it, for 4 dogs that have suffered so badly. They're very sweet and kind-natured.
And still trusting.
All right, well, what I think we need to do is, all these guys look like their conditions are quite manageable, but this little one clearly needs my help.
You sort of really wonder how and why this happens.
Just so patchy, aren't you, sweetie? Gosh, look at that. Just non-existent coat, eh? There's more skin than coat there, isn't there? Yeah, there's little bandy legs are shown off by the fact you've got no fur on them, so you can see the amount of fur that she should have in this patch there.
Is this new fur that's coming through, do you think?
Could well be. I mean, it depends what the cause of the hair loss is.
Will she get her fur back?
I don't think she's lost fur for no reason. I'm pretty sure we're going to find a reason here. And I think that reason could be anything from mange mites to hormonal conditions.
Right.
So I think what we need to do is take it to the practice and then just get to grips with what exactly is going on.
So you're going to go with Scott, he's going to take care of you, and you're going to come back, well, you're going to find your forever home, and you're going to be a stunner. Just going to be a beautiful little girl.
Yeah. You are so
little
lovely.
rest.
What are we going to call this little lady? What do you think?
I don't know, she's very tiny, she's so petite.
Yeah,
She's going to be beautiful.
I reckon. Yeah. What are you
Maybe
thinking?
we could call her Kylie?
Kylie. Oh, nice Aussie name. I like it. Yeah.
I thought you might like that one.
I do. No, well, who can't like Kylie? Hey. Oh, gee whiz. You wish you'd be as good looking as Kylie.
Yeah.
Hey. Well, let's see what
It's
I can do.
something to aspire to, isn't it?
It is. I'm not a miracle worker, but I'll try my best. Hey, Kylie, I like it.
I think she's got potential.
It's a hell of a namesake. Eh? It's a lot to live up to.
Well, she is so tiny, and she's just, well, she's petite, isn't she?
She is. She is.
She should have a lovely little pretty name, and
Yeah. You've certainly got a perfect personality, eh?
hasn't she?
Yeah.
Sweetest little girl.
All right then, cutie. Hey, your little trip to Richmond?
She's really stolen my heart, this little one.
She has. Say goodbye to Sonia.
Bye-bye, darling. We all get quite attached to the dogs down here. We might only spend a few days with them, but we love them all, as if they're our own, really. Okay.
I never understand how people can be cruel to animals. They're defenseless, innocent creatures. Why would you be mean to them? Why would you hurt them or neglect them? I just don't get it.
Take care. Bye-bye.
Aren't they beautiful? Let's go and see everyone.
Oh God, who's this? Wow.
I've just taken Kylie back to the practice, and understandably, people are a little taken aback. She's a very friendly, sweet-natured dog, but wow, she makes a first impression.
What's the matter with her?
Well, it's a long list of ailments that little Kylie's got going on, I'm afraid.
It's so sad. You're in good hands now, little one. Look at that little tooth.
Kylie's not the only special guest that we've got at the practice today. We've also got our new vet graduate starting as well. Riaz, fresh out of vet school, he only graduated yesterday, and it'll be very interesting to see how he gets on. Hey Riaz.
Hey Scott, how you doing, mate?
I'm good, mate. How are you?
Good to see you again.
Congrats on the graduation.
Oh, cheers, pal.
How'd it go?
Oh, mate, it's amazing.
Yeah?
5 years, finally there.
So, and here's our consult room. Oh, and it's Emma.
Hi.
Hello.
This is our head nurse,
Hi, Emma.
Emma.
Hi,
Riaz, nice to meet you.
Riaz,
How you doing?
grad, fresh off the press.
How fresh are we talking?
Oh, too fresh.
Yeah, as in like a day fresh.
Oh.
Yeah.
Like yesterday.
I'm glad the first person you met at the practice is our head nurse, because I would say, as a new grad, the person that you want to be besties with is definitely the head nurse.
So, head vet, but you call the shots.
Yes.
Pretty much.
Yes, I do.
Yeah.
I'm glad we've established this hierarchy on day one. Get it right from the offset.
From the very beginning. So,
Brilliant.
you, Scrubs, you downstairs, and I'll bring the dog. I thought today that Kylie would really help to flex Riaz's veterinary muscles. So guys, meet Kylie.
Oh my God.
A baptism of fire to try and understand everything that's going wrong with this dog and what we can do to help her.
This poor thing, what happened to her?
Hi, sweetheart.
Well,
Gorgeous.
we have virtually no history on this dog whatsoever, so we have to piece it together ourselves. So you're going to do a full exam for me, tell me all the issues that you find, and how best we're going to treat them.
Right, well, let's get started then. Look how much hair she's lost. You can see right through to her skin, and you shouldn't really be able to do that at all. When Scott told me there was no history, it was literally like a nightmare. I was like, oh, can't I just have an easy vaccination or something to do? But I'm happy to do that, so bring it on.
We're going to start at the front of you, little girl, and work our way back, eh? Here, a little look inside. Oh, darling, you're missing quite a few teeth as well, aren't you? Skin's quite darker as well in patches. She must be really itchy. This is clearly something that's just, not happened overnight. Checking these ears of yours. Oh, you've been scratching these ears a little bit, have you? A glamorous job of smelling dogs' ears as well.
I was about to say, is this a diagnostic tool they teach you in veterinary school?
It's one I picked up myself.
Nice, nice.
It's actually something I enjoy.
Just have a quick little listen to her.
Good girl. Okay, that sounds fine on that side. My professor at university would be very annoyed if I didn't listen from both sides. I hope he's watching.
No, I've never seen anything like Kylie. I think she's the first and hopefully the last time I ever see anything like that.
I mean, just looking at her tummy and her mammary glands here, she's clearly had puppies.
Well, you'll be horrified to know that just 2 days ago she had a stillbirth at the kennels.
She didn't. Okay.
Yeah.
Wow.
Everything you've been through. Yeah.
It's not fair, is it? When I heard that she'd lost a puppy, I lost it myself. I broke down. I don't know if it's a maternal feeling, woman to woman, but the thought of losing your baby in a stillbirth, it just made me feel for her. It's just not fair.
So, Dr. Riaz, what do you think?
I think what we should find out first is the skin problem, whether it is a simple skin problem, whether it's just a parasite or something like that, or there's an underlying cause perhaps. I think we should start with some skin scrapes.
Good, you've done this before?
Yes, in training.
Scraping the skin with a scalpel blade, it's not nice. But what we're trying to do is to try and pick up any evidence of mites. Lovely, that's great, good work. Good job, good girl, honey. There's a couple of different types of mites that could potentially cause the amount of hair loss that we've seen in Kylie. And then we look under a microscope and see if we can see any of these little things. Where are you, little blighters? They're gonna be in here somewhere. So guys, no mites found on this microscope slide. So what are we gonna think about that?
The fact that we haven't found it doesn't rule it out. So I think what we should do in the meantime is start treating for the mites and perhaps run an additional test to confirm the presence of it, something like a blood test.
Sounds good. It seems to us that the biggest likelihood is that Kylie is suffering with mange, and the best way to kill off a mange mite is by giving the dog a bath and start helping Kylie to recover and grow that fur back. Now you've got to give a dog a bath. A very technical job.
I'm very qualified for it, let's do it.
Riaz has done extremely well working up this patient. He has good understanding of the types of conditions that could lead to this poor little dog's problems, and then the best way to treat it.
We don't know yet if we're treating for which type of mange, so we're just gonna hit it hard. So we're just gonna not get her face too much. This bath is not the nicest thing. We're dressed up in masks and gloves because it's pretty strong stuff, and poor girl is just stood there taking it. So what we'll do with the rest of it is just sponge it on a little bit.
You get free tummy rubs. Hey? Hey, gorgeous. So I think the important thing with this is that we just get a good coverage. The way this works is it will kill the bugs from the outside and hopefully make her feel a lot less itchy, and she can start to grow some of this hair back.
Absolutely. I can't wait to see her full of hair again.
I know. If it is just some bugs on the surface, then we should start seeing some progress in the next few weeks with regards to her hair coming back. I never thought that I'd get such an interesting and a bit bizarre case as I have today.
And with me, your first nurse.
That's true. How does it feel to take... No, I can't say that.
Your nursing virginity. I can't wait to see her full of hair again. I bet she's gorgeous. I challenged the mites to survive the white stuff. All right, lovely. I think we've doused you and bathed you enough.
We're still awaiting the results of the tests to see if there are any underlying conditions, but at this moment in time, I'm quite optimistic for Kylie.
Bless her. Normally dogs take so long to dry, but she's got no hair, so she's dry already.
Look at her.
Say thanks, Riaz. Thanks for day one.
Bye, gorgeous. You're
Go
going to
on,
sleep well,
sweetheart.
aren't you?
She's a little bit quirky looking at the minute, God love her, but everyone has just fallen in love with her. She's got the most expressive little face, and her little tail, bald as it may be, doesn't stop wagging, and she's just stolen everyone's hearts, I think, today. Well, you'll feel better soon, I promise.
You'll never forget your first sort of patient, regardless of what it is. I think I'll remember Kylie forever.
All right, honey. Get you some dinner. Shall I get you some dinner? Kylie!
Well done! Look at you, well done.
Hello, Sonia.
Scott?
Oh my God, Kylie! How are you?
I'm good.
You look incredible.
Doesn't she?
She's an absolute vision, isn't she?
She looks fantastic. Did you recognise her?
Hardly. Well, first of all, she's got hair. It's incredible.
We were really concerned about Kylie. She was covered in fleas. Her skin was so bad. She was so undernourished, so underweight.
Who would let their dog turn into this?
Get into
I mean,
this
it's
state.
disgusting.
She was quite a poorly little dog, and she's just come a really long way. Kylie is just loving the attention, and she deserves it. So I say, go Kylie.
Hair
She's
on
like,
the
look,
face.
look at me, look at me. Her legs.
Hair on the legs. Hair on the tail. Look at that. Kylie looks absolutely amazing. I can't believe this is the same dog. She looks beautiful. You look amazing. Wow.
She is a princess.
Oh, you are. Let
you
me
go.
have a
Who's
look at
that?
you. Hello, beautiful. How are you? Mwah.
Remember Scott?
I think what the irony is here is that she had fox mange, and now she looks like a
And
fox.
you look like a fox.
Don't you?
You look like little Foxy,
Hey?
Foxy Kylie. I hope that she's just going to be as happy as she is and have a lovely life with people that will love her and look after her, give her the love that she deserves. We adore her. I think Scott's fallen in love with her as well, so.
Beautiful foxy Kylie. Yeah. Good girl. I'm driving out today to see Andy and Keely, who run the Mayfield Alpacas Animal Park. And recently they asked me to pop up to help with their randy meerkat, Nguvu. Now this time it's not meerkats or alpacas even that are causing the problems, but a creature much more associated with Christmas. So I just hope that I can help.
Good boy.
Come on, Elsa. Come on, Svenny. Come on, good boy. There you go. Good lad.
Hi guys.
Hiya.
How you doing? Hey Keely, good to see you.
Yeah, you too.
Hey Andy, good to see you again. Merry Christmas.
Merry Christmas.
So, you've dragged me all the way back up to Yorkshire for reindeer. It's Christmas.
Yep.
Preparations need to be made. So tell me exactly what I'm doing today.
This is Sven, so he's our male reindeer. And then we've got Elsa over there. But it's Sven that I really want you to look at today. Scott's here today to help us trim the feet of a reindeer. So our reindeer feet, they do continually grow, so sometimes they splay out and then they can crack. So Sven's feet are looking like they do need doing. He does need a Christmas pedicure because he does have to look nice and sparkling, ready for his crowd.
What an incredible festive thing to do as a vet, to trim the hooves of a reindeer.
Sven's quite feisty, so yeah, he'll have his work cut out for him.
Let's just say they've got some Christmas spirit in them. We'll say that for the minimum.
It looks like a pussycat. What are you talking about?
Yeah.
I'm sure if elves can do it, you can do it.
If elves can do it, I can do it. There we go. Kinley and Andy are playing it a bit cagey about how friendly or not the reindeer are. But look, it's Rudolph. What have I got to worry about?
She'll keep him calmer, and we'll say calmer.
Sven and Elsa are really nice reindeers. They're Norwegian. They're coming up to 2 years old. They don't look very big, but they are very strong. Elsa is a little bit more nervous. She will come up and hand feed, but Sven has got a lot more fight in him. I think we should try you with Sven. He's the nice one, honestly. Both the reindeer have got their long lines on, so all I need you to do is go up to them, stand on the long line, and then just reel them in.
Okay.
So like a big fish.
And as an Aussie, you should be used to that.
Right, sounds
that
so easy.
makes sense.
Yeah, no,
Yeah.
it sounds
Yeah.
very easy. And your experience is as a vet nurse, is that right?
Yes, that's right.
Like every vet nurse I know, very good at direction.
Yeah, we're very good at giving instructions. So
Right.
that's what we are. Not bossy, just we know what we want.
Okay, good. Well, I'm ready to be instructed to you.
Yeah.
Yep.
Okay.
Always.
Right.
If you just come through this way,
Okay.
mind the rear.
Let's go. Come on. Oh, and they're off already. Oh my goodness.
Scott, I'll give you those.
Oh yeah. Thanks, mate.
Scott looks a little bit nervous,
Come on, Sven.
but Scott's a big Aussie guy. I'm sure that he can deal with the sort of power that's behind a small reindeer. It's nothing compared to a kangaroo or a great white shark, so I'm sure that, you know, that Aussie fight can come out.
Oh, so close. So close.
We usually try and step on the lead rope and then reel them in from there. Scott's method seems to be diving on the lead rope.
I was so close. Honestly, I had it.
Not a method that we usually use and not one I've seen before. It's comedy for us, we quite enjoy watching it.
It is way harder than I thought it was going to be. I honestly thought that it would be a really gentle walk along, hold the rope, draw them in, give them a carrot. But no, these reindeer are fast.
He's got her.
Well done.
Show off.
I had mine. I had her, gloated a little bit too much, got a little bit too enthusiastic, and her lead rope snapped the actual head collar and she got away.
Yeah, see, that's what happens when you show off.
Definitely the reindeers are winning.
Yeah, that made me laugh.
Okay, no, I'm not giving up now.
Just a warning, they can jump 6 foot as well.
Oh my God.
Scott's definitely getting a bit hot and sweaty and a little bit frustrated, I should think. He doesn't look like he's going to give up though.
Come on, Sven. Crap, are you kidding?
Oh gosh. We have contact. Not quite as
So
quick as
close.
India.
I was so close. Oh my God.
He doesn't look like he's going to give up though.
Got him.
Keep hold, keep hold, keep hold, keep hold. Reel him in.
Come on, mate. Oh, man. Come on, Sven. Come on.
Keep nice and calm with him
Good
and just
boy.
be careful as you get him close to you.
Good boy.
The reindeers, they use their feet to kick and they also use their antlers to headbutt you as well.
Come on, Sven. Come on now, buddy.
Yeah, try and hold as close up to the head collar as possible and then keep to the side of him. Just
Okay,
in
so
case
actually try and grab his head collar.
just underneath you where the buckle is,
Okay.
and then you should be able to start walking
Okay,
him.
Sven.
That's it.
Good boy. Good boy.
Perfect. And then so you're at the side of him, both hands on the lead rope.
Okay. Okay. Good boy. There we go. Let's be friends.
That's it, isn't it?
Good boy. Oh yeah. Come on. Go.
I think the adrenaline's pumping in Scott. He is doing a good job. He's doing the right movements. He's talking to the reindeer.
Come on. Come on. Let's behave nicely now. Come on.
I think the competition's on now to see who can hold on to who.
Whoa. Come on. Wait. Hey. Calm down. Come on.
Even though it does look a bit of a stressful experience, probably for all involved, not just the reindeer, it's something necessary that they need doing. So as the feet do get longer and they do become splayed and cracked, that can cause infection and pain as well. So we try and do it as quickly and efficiently as possible, even if it does look a bit manic.
Come on. Come on. Sandra's waiting.
Honestly, it is like trying to dance with a big, massive reindeer. He keeps spinning me round and round in circles. He's bucking.
Come on, lad.
Not much further.
It's an absolute nightmare.
It'll just be a bit of a dance on the way up there.
Yeah. What kind of
You're
dance
not too
is
dizzy,
it?
are you?
Come on.
It's funny to watch someone else going through that. Usually I'm the cannon fodder, but it's all practice. At least he'll have a good dancing skill at the end of it.
I'm not thinking it's ballroom, or if it is, it's really bad. Now I know how Santa feels. It's so exhausting.
Nearly there.
Come on, mate.
We're nearly at the barn, and honestly, I can't wait to let go of the halter.
Wait. Come. Okay.
All right, do you want to back in? Hey? Can you reverse park? Hey? Whoa!
Made it.
I'm absolutely exhilarated to get to the point where we've finally been able to release him and let the big guy go. Was such a relief.
You all right?
I've been reindeered.
Rest time.
Oh God, that's so exhausting. How do you do that every Christmas? That is ridiculous.
So we've got him up to the barn, so we'll leave him in the stable for a while, for at least an hour or so, just so he can chill out, have something to eat, and he's not too stressed. If we went in there straight away to try and do his feet, I don't think he'd allow it, because it's been a bit of an experience getting him into the barn. So now we just need to let him be for a while. It'll be worth it, Sven. Sort your feet out. Good boy.
Well, I think that's overstating it. Good boy indeed. Reindeers are feisty, plucky, very powerful creatures, and yes, they're absolutely beautiful and a massive part of Christmas, but wow. I can understand why Santa gets so exhausted on Christmas Day. It's not the presents, it's the reindeer. After that, is Sven going to be on the naughty list? Possibly. He's a beautiful reindeer, but I think we need to spend some time apart.
See if he's a bit more relaxed about everything now.
Let's hope so. I am after that break, I can tell you.
Yeah.
Hello, mate.
He actually looks a lot happier.
He does, much calmer,
Yeah.
breathing much more slowly and relaxed. That's good. Pedicure of a reindeer. I'm getting nervous again.
He looks quite happy now.
But I've learnt my lesson from last time. So what's the plan, boss?
What we'll do is send Andy in, if you're happy doing that.
Thanks.
Send
Lucky
just one
boy.
of us in, yeah. So if Andy can go in and pin him against the wall, then I'll get another member of staff to hold on to him as well, so there's two of them. And then we can get going trimming feet. We'll just try and do it without sedation first.
Yeah, I think that would be nice.
For him.
Yeah, quite a risky thing to use at
Yeah.
the best of times. So let's try and see if we can do it without drugs, shall we, mate?
Sedating reindeers can be a bit of a problem just because they seem to not need to take as much for the sedative to take effect. So we've got to be really careful not to overdose them. I am sending Andy in first.
All right, fella. Shh, shh, shh. I know.
He does seem to like to go in there and get involved.
This could potentially be quite a dangerous situation. Steady, steady. So, as always, I'm used as cannon fodder. I know. We've got not only antlers, you've also got the ability for the animals to kick, not from just from the front, but from the back, and they're not like other animals. They can kick to the side, they can jump and actively go for your face. It's definitely a hard task ahead. Luckily, Scott's on hand in order to try and sedate him if we need it, but if we can do it without, that'd be much better for the welfare of the animal. Just watch his back in. There you go.
All right, going in.
That's actually a really good position.
So I'm at the front pinning Sven at the minute, and we've got Nick at the back. And at this point, all I'm concerned with is keeping the head down. Nick will keep his back end down, and we should be safe.
How you going there, Nick?
Fine. I'm looking for any sudden movements. If the animal feels that you are relaxed in any way, shape or form, he'll take advantage of that and he'll jump up.
What's so incredible, Keely, straight away I see is he's got 4 toes.
Yeah, so they were like snowshoes then.
Yeah, so what, they sort of splay out on the snow?
Yeah.
Amazing.
Really good job.
Huge.
So this joint here clicks. And that click is a communication. People seem to think it's something wrong with the joints, but it's not. It's a communication between reindeer in the dark. If they can hear that click, and that click means there's another reindeer there, so it's safe, not a predator.
Because so many people would think that it's just the hooves hitting the ground, but it's not. It's actually the ligaments in the joints.
Oh, they think they've got a joint problem, and they haven't. That's normal for a reindeer.
Wow.
If you heard it on a dog or a cat or a llama or an alpaca, you'd think that was something strange, but...
Learn something new every day. All right, so how much of this, I can feel it's very thin there. Reindeers in their natural environment will wear down their feet by walking on rocky surfaces. Here we go, mate. When they're in a paddock, of course, the hooves are going to continue to grow, and that's why they need trimming. It is dead keratin, so it's not going to hurt, eh? Okay, mate. Happy with that?
Yeah.
All right. Okay. Nice. Although what I'm concerned about now is I've sharpened it up quite a lot for next time.
It's got points.
Yeah, it's got points.
So things are going really well at the moment. The feet are being clipped without too much problems. Sven is actually behaving himself. He's been really calm, he's been really still, a lot better than I thought he would be. I don't want to jinx anything at the moment, but he's looking really good. Yeah, we weren't expecting him to be this good, were we? Not at all.
I know.
Yeah, reindeer whispering is paying off, I think.
Do you think?
Yeah.
Being dragged around a field by a reindeer. If that class is whispering, then I'm very good at it. Okay, so Kylie, how's my first?
Hey, that's good.
Pedicure on a
That is
reindeer.
good, yeah. Look at that. Nice and smooth around, a lot shorter.
Wow.
Play it with underneath.
Maybe
Yeah, that's good.
maybe I've missed my
Yeah.
vocation. Reindeer nail clipping. Nails by Dr. Scott. Available only at Christmas. All right, so that's one side of our deer done.
Scott's very good with Sven. I think they've had some reindeer whispering. They've done really well after the little bit of a to-do in the field. He seems to have got control of him, shown him who's boss. So he's going really well. Ready?
Yep. Just get to his leg
Try and
there.
get to a foot again.
Good boy. Amazing. All right, let's get that extra toenail off you, mate. Good
Don't let him
boy.
fool you though.
No. Good boy. Final foot, then we'll get you back to your girlfriend Elsa, hey? Yeah. Come on. It's been really interesting to get to know reindeer today. I didn't know that they were as strong, as powerful, as feisty, but now I totally understand why Father Christmas chooses them to pull his sleigh. Okay, last one, and we're done. I'm not convinced that I've got a friend for life with Sven. I think we have a healthy respect for each other, but I don't know if we're going to be great mates in the future. I love Christmas, so hopefully he'll take that into account. Right, there we go. One completed reindeer pedicure. I'm pretty happy with that.
Yeah,
That's
really
perfect.
Yeah.
I think Sven's going to have a really good Christmas now. His toenails, they look really nice. He'll be ready to step out at Christmas, greet his crowds.
Good luck, Sven. Hey, I hope that Elsa's impressed with your new footwork. And have a good Christmas. Today I'm off to Wales for something completely different and I really need to get on the road. The idea first came up when a client of mine mentioned that they had a relative that runs a big rural practice in the beautiful green rolling hills of Wales. Now, I have always had a bit of a daydream that one day I'd pack up the family and head to a completely different environment, somewhere with clean air and wide open spaces, and become a country vet. I'll be the first to admit that I'm going to be completely out of my comfort zone, and I'm pretty nervous. It's been a very long time, pretty much since my university days, since I've seen the business end of a cow or a horse. So it'll be very interesting to see if I can convince the locals that this city slicker's got what it takes. Up to you.
Yeah.
Hello there, ladies. How you doing?
Good, how are you?
Good. I was actually trying to work out how to say hello in Welsh. How do you say it?
Hello.
Oh, so you just say it with a Welsh accent?
Yeah,
Good to know.
keeping it simple.
Yeah, well, you definitely need to do that for me. I'm supposed to be seeing the boss. Whereabouts is he?
Straight through there.
Wish me luck.
Good luck.
Hi there, David.
So pleased to meet you.
And
welcome,
you.
Yeah, welcome to beautiful Wales.
Look, I'm so excited to be here. I can't wait to get started.
But gee, look how you're dressed. You're a real city boy. You can't come onto a farm like this. We're going to do real work. We're going to see real animals today, Scott.
Okay, all right, I'm intimidated already. All right, what have you got for me?
We've got a busy day on farm, so I need to get you some proper gear.
Not my usual kit, I'll be honest, but look, I'm happy to get stuck in with the farm work.
Right, let's get you kitted up and then we'll crack on.
Sounds good.
Good.
Forget any notion of lazing around watching the grass grow in sleepy old Wales. We're into it straight away.
Good girl. Off you go.
This should be 51 days.
There are 3 generations here, my grandmother and then my mother and aunt and I. Everybody has an opinion, but as long as we get there in the end, that's the important bit.
Hello there, ladies.
I'm Virginia.
Hi, Virginia.
I'm Olga.
Olga, hello.
Hi, Stephanie.
Hi, Stephanie.
Isabel.
Isabel, I'm feeling a little bit of intimidation with you four already. Do you normally feel like that when you come here, David?
I've got used to it over the years.
You got used to the girls.
I'm acclimatised.
Right. So what have you got me here for today?
We've got a pedigree bull, so we need you now to have a look at him to make sure that he's fit for breeding.
Right. Well, I'm so glad.
Are you up to the challenge?
Well, I'm not sure if I am really. I've not seen a big hulking bull in quite a while, so I don't really know what I'm looking for. What will I be looking for?
Yeah, we'll be checking his testicles.
Right.
Most importantly.
Excellent. Yeah. No, that's brilliant. With this for watching on, I'm sure I'm going to go just fine. All right. Well, shall we unleash the beast?
Let's go. If he's used to smaller animals, seeing a bull is going to be totally different.
I'm very worried about seeing this bull. I'm sure he's an absolute giant.
Bulls can be a bit aggressive, they can be dangerous, so I think we've got to be careful in this situation.
Oh, great. It's tiny.
Bull, there he is.
I was expecting something this high.
You'll grow into a big bull eventually. He's only a baby. Let's go down and have a look at him, Scott.
Hello, boys.
If you look carefully, you'll see he's got a tremendous hindquarters. He's really well built. And so that's why they feel he has potential as a bull.
So what you're saying is that he's got a bigger bum than the other one. And from a beef cattle perspective, he's going to pass it on to any offspring that he has, which is also
that's right,
very
yes,
positive.
And produce very good beef calves as well.
Dave and I commenced the examination of this bull from head to toe to make sure he's up to scratch and he's going to be a good dad to all of the Roberts family's new calves.
He's got a lovely temperament.
Yeah, I can tell. Yeah, he's
good boy. He's just very strong. He's a very strong animal. But otherwise, he's lovely and quiet. You can handle him quite nicely. We'll just check his teeth, see what his teeth look like in his mouth.
Yeah.
Good alignment of the teeth with the upper jaw. Would you like to have a turn and examine him? Have a look at him?
Yeah, sure. This bull is maybe not as big as I expected, but it's certainly bigger than all the patients that I treat in Richmond. Good boy. Are they like dogs and cats? Do they respond to being talked to?
Yes.
Yeah, definitely.
Yes, they do.
Definitely.
Oh, well, there you go.
They know your voice.
Oh, hello. You probably haven't heard my accent before around these parts, I wouldn't have thought. Hey. G'day, mate. How's it going? Hey? Hey, you're a handsome fellow. Nice, incredible. Incredible to look at these beautiful brown eyes close up. Very nice.
Right, let's check his height.
Yeah. Good boy. Good boy. My initial impression is that it's running faster than I thought it was going to be.
But just same with dogs and cats, the younger they are, the faster the heartbeat.
Yeah. His eyes seem good, his heart seems good. Everything else is looking very, very good. But at some point, I know I'm going to have to go to the business end. All right, Mel, and I promise to be gentle.
If the bull hasn't got good testicles, then he won't be able to work as a breeding bull. Getting nice and close to him. Okay, grab both testicles. Get a nice firm grip there, Scott. Well, Scott's definitely got his hands full, but he's got great technique. Feeling good?
They're very firm. They're very impressive. I feel myself blushing. It's a nightmare.
Well, in the bull, he likes his scratches and he likes to be with people. Obviously, they're bonding.
Good, just check them for symmetry and size. Check for any lumps and bumps. And they're of a good size for his age. Everything feels great.
They do feel great. Ladies, I think that your bull, hopefully, he's got the equipment suitable. He's ready to go. I think the Roberts family are going to be very happy to know that their bull's up to the job. I'm just not quite sure that I am. Okay, big guy. There you go. Good boys. This farm stuff's hard work. It's been such a long time since I've been at a dairy farm. It's been, say, 17 years, so a long time. And I'm actually really looking forward to it.
Ready to crack on?
Yeah, absolutely. David obviously is the lead vet here. He's the man that knows what he's doing, and I'm the humble pupil.
Yeah, I've got one for you as well, Scott. We'll get the scanner out for you now on the front there. Just put this on, put the headset piece on.
Wow. It's got a bit of kit, isn't it?
Yeah, we're all spaced out now.
Yeah. It's a very interesting kit. It looks straight out of Star Trek kit. It's basically just an ultrasound. The same thing that we would use in our clinics back in Richmond, but this is designed for internal use. And I'm not very much looking forward to where I'm going to have to put it.
Have you got an image?
Oh, wow, yeah.
Cool.
Yeah,
good.
so that's the ultrasound scanned image I can see right in front of me.
That's right, yes. Okay, let's go.
I'm actually feeling surprisingly nervous, way more nervous than I ever expected that I would. I'm an experienced vet, but not experienced when it comes to large animals. So I feel like I'm almost going back to school. Morning, girls. How you doing? I just hope I'm up to the challenge. All right, so here's the first lot of patience for the day. Here you go, good girl. Hello, ladies. I promise to be gentle. It's really important that every cow on the farm gets pregnant every year. If they produce a calf, then afterwards they can produce milk. It's just like when you're a mum, you only produce breast milk once you've had a baby, and the same applies in cows.
I'm just going to scan the first few cows. Yep. And if you just watch and see what I'm doing, and then later on you can have a turn, have a go, right? All right. So we're going to use the scanner to see if they're in calf. Just put that.
Most of the time, these girls have a lovely time eating grass in the beautiful Welsh fields. And the farmers, of course, keep very close tabs on them, but every now and again, they do have to get them in and do medical procedures on them. It has to be done, but hopefully we'll be as gentle and as kind as possible.
Good. Mark with chalk. Mark a blue when she's in calf. So you know, all the blue cows are in calf.
I've got a nice blue tail.
That's right, nice blue mark on the back.
Okay, next.
So you've got to watch them because they will barge on.
Okay. I'm like a cow bouncer.
That's right. You're doing a great job there.
Thank you very much.
I know that Scott will find it a challenge. And just putting his arm into the cow, it's a whole foreign environment. And I think he's really got his work cut out today. I've scanned it, I've checked her. So we'll now give you a go and see what you can find in the cow.
Okay.
So, you all ready?
Yes.
Is the scanner turned on?
It's definitely on, so at least the equipment's right. I can't blame the equipment.
Okay, good. Let's see how it goes.
It's been such a long time that I've worked with cows, and so I really want to make sure that I don't embarrass myself too much. I'm totally put off by the sound effect she's giving me there. That's pretty impressive.
Go on, get on with it, and we'll see what you find.
Okay, I'm going in. So, oh man. That's an experience I haven't had in 17 years. That is, oh man.
I'll be quite happy if Scott can just find the womb initially.
Is it in the top left-hand corner of the screen? Would it be there?
If he finds a pregnancy, I'll be really pleased.
What can I see here? Okay, I'm trying to find her uterus.
Just scan left and right, move the probe over the womb, just left and right.
It's absolutely amazing to be able to use an ultrasound like this in the field. Oh, wait a minute. What's that?
I can tell from Scott's expression how he's getting on. And initially I can see he's really concentrating, he's focusing on what he's doing. And then eventually you can see his eyes light up.
Oh.
And you think, wow, that's the eureka moment. He's seen something wonderful, great, fantastic.
Okay, teacher, please tell me, I'm pretty sure this girl's in calf.
Yes, she is in calf. Well done, Scott.
Oh, thank God.
She's in calf, she can go. And then, of course, you have to move on to the next cow, and the next, and the next, and you have to do it all over again. But so far, he's doing great. We'll make a farm bet of you yet, Scott. Welcome to Wales.
Oh, mate. This is an incredible experience. It's so out of my comfort zone, but also really exciting and interesting and different. I've just got poo on my lens. I've had a poo accident. That's nasty. And now I'm covered in poo. How can I wipe that off? Philip mentioned about the fact that there's a foal hernia. Now, I haven't done horse surgery since university, so I'm incredibly nervous. I hope I can help, and I hope that Philip has faith in me. Hello.
We're going to send you up the paddock, pick up the foal, and Kim and I are going to start setting up in the barn.
Okay, I'll get the foal, you get prepped.
That's right.
Sounds good. All right, see you in a bit.
Right on, okay now. Normally I do these things on my own, so it'll be quite novel to have an extra pair of hands there.
You don't know what you're in for, do you? That's my coat you got hold of. Don't pull me over. Don't pull me off. He's naughty. Let go. You haven't brought him up with very good manners, have you? You have him, Misty. I spent a whole lifetime with horses. I don't think I would want to live without the horses. They mean everything to us.
Hi there, Di. How are you?
I'm very well,
Lovely
thank you.
to meet
Getting
you.
a bit wet, but there we are.
A little bit wet, a little bit windy, but there we are. We're in Wales,
we can't
in a
help
field.
it, can we?
Very brave boy. You going to be a brave chap? Hey? Yeah, you can see so clearly that hernia. It's a decent-sized one, isn't it?
It's nasty, isn't it?
An umbilical hernia is basically a hole in the abdominal wall where the muscles haven't closed after birth. And what happens in Freddie's case is that the abdominal contents will leak out through the hole and lead to a bulge under the skin. I promise I'll look after your boy. I will.
We've all made that promise to her, haven't we, girl?
Okay. Come on, Freddie. It's all about you, mate. The real danger in Freddie's case is that his intestines can pop through that hole and then their blood supply is affected, and literally Di can walk out into the field one morning and find Freddie dead. So it's crucial that we perform this surgery today. Good, Misty. Good boy, Freddie. Good lad.
Misty's there, so it's comfort for him. Once he's under anaesthetic, he won't know what's going on. But all the time Mum's there. If you take Misty out, well, then he can get upset.
Come on, Freddie, good boy.
Well, any operation is a risk, isn't it? They're like children to us. You know what can happen or can't happen. You hope for the best, obviously, but there's always that element of doubt.
Okay, I think we've got everything else here, so yeah, basically we're good to go.
Come on, Freddie. Guys, I've got your patient. I walk around the corner into the barn and it's a little rustic. I can't see any shiny lights. I can't see any steel. It is a shed full of hay and we need to do surgery in it. Different. So, Philip, I was going to have a quick feel before we knock.
That's right, yeah, because it's quite nice to know now exactly what we're dealing with and how big the actual opening into the abdomen is.
So I can get 2 fingers into the hole.
Okay.
Definitely bigger than the hernias that we feel on little dogs and cats back in Richmond.
Yes, I'm sure. Yeah, that's right. Scott can extrapolate what we're doing back to his own animals in his own surgery in London, and the actual techniques are the same. It's just the scale that changes.
Wow. It's like a javelin.
Bigger than what you're used to.
It goes back here.
Yeah. Good boy. Just hope I get it in the right place.
No need for that.
All right, sweetheart.
No.
Trying to place an IV catheter into a horse, a massive different world. Where's your blood vessel gone, mate? We did our absolute best to get it in as calmly and as safely as possible. But this is a young horse, and horses can sometimes react erratically, and vets can get injured as a result. Good boy, aren't you?
Yeah, that's in. Good job.
Phew. Gosh, and that's the easy bit.
Yeah.
That was actually really difficult. I haven't catheterized a horse since uni, which is quite a while ago.
Stick to rabbits.
Yeah, stick to rabbits, fair enough. Freddie's being such a beautiful patient, such a good boy the whole way through. But obviously the time comes when we need to give him the drugs to knock him out and perform the surgery.
Right, so I'm just going to inject the ketamine into his vein.
Okay, we'll see on the other side. Hmm?
So it's really important that we're in a safe place. They're so heavy, and if they go down in the wrong way, they can catch you out, and you just need to have your wits about you, really.
Okay. Good lad.
Come to you, Scott.
Yeah. Oh, that's a good boy. Oh, what a good boy. You're right there, mate.
Stuck in the straw. Right.
Once the laughs are over, once Philip's managed to regain his footing, we have to crack on with the surgery.
So next stage now, we'll roll him onto his back. Roll him up. Okay. We'll just crack on and get ourselves scrubbed up and ready to go.
I've done countless umbilical hernia repairs in dogs and cats. That's bread and butter for me, but this is on a bigger scale completely, with an animal that can kick me in the head, and then I'm being watched by Philip. Quite intimidated right now.
You'll be fine. You will. Nervous now, very nervous. I'll be glad when it's all over. He's up and with his mum.
Right, now, so I'm going to make my initial incision up here. So we should be far enough away from anything dangerous. Surgically, the main risk is that we could damage the intestines as we're going in. And also when we're putting the sutures in place, there's always the risk that we could actually accidentally catch part of the intestines, and that can cause quite serious problems. Well, there we are. So we've got bowel there straight away.
That was just millimetres underneath that sac.
That's right, so we didn't want to damage that at all.
Well, that could lead to all sorts of complications, like peritonitis and even death if you nick that.
Yes, we nick that. It's just like having a burst appendix, really.
If you nick in the intestine, then the horse can get a massive infection called peritonitis, and they can die from it. It's exceptionally painful. It's an absolute nightmare. So it just shows that this procedure is actually a very serious one indeed.
And now that we're in there, the actual hole is a lot bigger than what we could feel on the outside.
That's amazing that intestine pops out so easily like that.
Yeah.
Wow, it just shows how important this surgery is.
Oh yeah, yeah. Basically a strangled hernia is where some bowel comes out and the blood supply to it is cut off. Then the animal can be brought in, and then an emergency op if you're lucky, or a dead horse in the field if you're not lucky. Right, I'm happy with that now. Okay. So I think we need a third, so if you'd like to do that.
Yep. Okay. Got you in the finger.
That is my finger, yeah.
Oh,
I'm aware of that.
That would have been instant dismissal.
Oh, this is a treat for me. I don't usually have another pair of hands in here on this job.
Happy to help.
Yeah. That's lovely. Okay, good man. I think Scott is doing very well. Although he hasn't handled horses or large animals since he left college, he's got his good surgical skills. That's it, it's gone.
Nice, neat tummy, all tight for show jumping.
That's right. Okay, Scott, take the leg.
Yep.
That's it.
Good boy, Freddie. Good lad. This can be a really dangerous time for horses because they can react erratically. They're very strong, and so he can go from being an animal that's just been fixed to an animal that's very easily broken. Come on. Mummy's just over there. Good boy.
It's almost over now, so hopefully he'll get up and be a bit wobbly, but then Mum can look after him. Everything will be all right. That's fingers crossed.
There we go. Up you get. Come on, buddy. You can do it.
There we are. Lovely.
Good boy. Freddie takes such a long time to wake up, but slowly he comes right. Look at him struggling towards Mum.
Yeah, I think he wants a feed, doesn't he?
He wants a feed.
He wants solace.
And that's an absolutely glorious moment. It's a real relief to see him up and then suckling from his mum. Absolutely beautiful. He's gone to the milk bar. So Di, that was quite intense. I must say, I was probably
But it's over now.
as nervous though as, well, I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that. Scott has done brilliant. And he's been nice with him, and that means a lot.
Good boy, Freddie. I must admit, I've absolutely loved it today. Di's an incredible woman. We're in a nice warm shed performing an incredible surgery on a beautiful animal with a great result. And my relief, I think, was just as much as Di's. Hopefully that's expressing his happiness at our work. Not bad, City Slicker. Good job. Hey Joe.
Hiya.
What's happening?
This is Toots I chatted to you about. So we've just done the x-ray, bladder's full of stones. Yeah, poor little man.
So just like 1 or 2 stones?
No, literally looks like sort of 30 in there, I think. So the more help, the better to get them all out, I think.
No worries. Okay, well I'll go and defarm and I'll be back in a sec. See you in a bit.
Lovely. I can feel he's a bit tender still when I feel on his bladder, so definitely that's still the area that he's sore in.
Yes.
I think what we need to do now is just take it to the next sort of stage of diagnostics, so to try and work out what's going on. And the best thing for that is going to be to do an x-ray.
Okay.
And go from there then, all right?
All right. You're going to behave yourself, are you?
There we are.
You little baby.
Brilliant. Good boy.
There's a good boy.
We've had Toots in with us today. He's a 9-year-old Bichon Frise who we've seen for recurrent urine infections. Come on then, there's a good boy. Come on, little man. Hi, Lauren. This is little Toots.
Hi, handsome.
Today we've taken an x-ray. And we've seen that his bladder's full of bladder stones. Oh my goodness.
Oh, wow.
I think we can see what the problem is. So the aim really is to remove all stones or as many of them as we can. So what we're hoping to do is just go in, assess the bladder, remove the stones and flush out any of the smaller ones. I think we're ready to start.
Right, finally I'm in a uniform that I feel a bit more regular in. This is my normal job.
It's going to be quite nice having an assistant, I think.
All right, let's get those nasty stones out, shall we?
Expecting the bladder wall to be quite thickened as well if he's had the stones in there for a little while. You can just see his bladder there.
Yep.
I can feel a stone just under my finger actually.
No way. Can I have a feel?
Oh,
Oh wow. It is like a bag of gravel. Yeah.
Poor little boy.
Yeah.
There's the bladder.
It's looking very angry and inflamed, isn't it?
Yeah.
It is certainly a very irritated bladder, and it's because of the stones within. And how big were these stones looking?
They weren't looking very big, but there's quite a lot of them. So I think if we start with a small spoon, and then if we need to, we might need to get the bigger one in just to see if there's any bigger bits in.
Normally, when you remove a bladder stone, it's a nice, round, smooth rock, really. It's like a pebble.
There we are.
Wow. These ones, however, are very harsh, they're very sharp, and they're deeply embedded into Toots' bladder wall. Nasty little suckers, aren't they?
It feels like there's quite a few more in there as well, I think. They felt like they were a bit deeper down.
Wow.
Goodness me.
Look at that.
Looks like a little hedgehog, doesn't it?
It does. There you go. Didn't know they lived in bladders. Oh, you gotta feel better with those out, mate.
Yeah.
The more we scoop, the more we find. It's incredible. They just keep coming, and they're really angry, sharp-looking stones that are getting stuck into the bladder wall and really causing irritation to poor Toots.
And I think it feels like there's quite a few more in there.
Poor boy, he must have been in some discomfort with those.
You can see why it's inflamed all the bladder wall so much, can't you?
As a boy, passing those types of nasty stones, ouch. Oh, there's a whopper.
We were expecting quite a few stones, but there's more here even than I thought there might be. They seem to be never ending. 27, and I think that's 28.
28.
Yeah, goodness me. And some of these look like sort of, 5 or 6 joined together to make a big one.
That's a lot of bladder stones.
And still a few more in there, I think.
Right, so do you feel confident then that that's the last one?
Yeah, I think that's it. 2 more from that last flush, so that brings us up to 30.
Look how chuffed you are getting that right on the x-ray. Very impressive.
We removed all of the larger stones, and I think it's the biggest haul I've had from a bladder so far.
All right, let's close this boy up.
Lovely job. It's going to be a bit of a recovery because there's obviously so much swelling and inflammation on the bladder wall. It's going to take a little while for that to settle down, but he should make a full recovery. Thank you very much for your help.
Oh, more than happy to do so. Being involved in this surgery, you might think, oh wow, it's opening up a bladder of a dog and pulling out stones. Well, for me, it was a relief. It was great to be in 4 walls and a roof, not covered in rain, not covered in poo, and doing something that I know how to do really well. What do you think I've got for me next?
5:15, it could be anything, so I'm sure they'll have something in store. As long as you've got your wellies on, I'm sure it'll be covered.
I just had a phone call from one of the young farm vets, Vicky, and she needs my help. I have no idea what kind of animal I'm dealing with, but I'm looking forward to seeing what she's got in store. Right, Vicky, the cavalry's here.
Oh, he's got muscles.
Right.
Hope you've had your Weetabix this morning.
Okay, why?
Oh, we've got quite a big ram to deal with today.
Oh, a ram?
Yeah.
Really? Hello there. You're a funny-looking ram, aren't you? Hello. Mwah. You're handsome. Hi there, Val. I'm
Hi.
Scott.
Hi, Scott.
How you doing?
Nice to meet you.
Nice to meet you as well. It's pretty much like Noah's Ark. There's animals everywhere. There's donkeys, there's a mule, there's little ponies, there's even a alpaca. It's amazing.
We take in animals that have been abused or neglected, and this is their forever home. People contact us when they know that there's an animal in need, because they know we'll go and get it. We just love what we do. When he came, he was just called Rammy. I didn't like the name, so I put a thing out on my Facebook page and asked for ideas, and somebody suggested Gordon. Gordon Rammy it was. I went out to the field today to check on them, and I saw he was bleeding from his horn. He obviously needs help from you guys.
So how are we going to go about catching this chap?
I think that's your job, really. Into this corner, just muscles.
Right. Right, wow, so it's very technical.
Just muscles, that's all we need today.
Okay.
I'm going to enjoy watching this, because I did it earlier. Gordon is very feisty. When I was treating him earlier, it was like buckaroo around the pen.
Okay, well, should we just get stuck into it, just vault this?
I would open the gate.
Right.
It's much easier.
Sure, okay. Fair enough.
Okay.
Here we go. There we go. That was easier. Yes.
I should have not said anything and just let him fall over, but I thought it was common sense. Why climb it when you can walk through it?
Hello, Gordon. Keep that infamous temper in check.
Yeah. Good luck, guys. You're going to need it.
Okay. Come on. Oh, my goodness. Yeah, boy. Come on, champ. This way. Oh, man. Come on. Come on. Good boy. Okay, good boy. Oh, you.
Who's winning here?
Well, it's sort of a tie at the moment.
Good.
Wow, that looks disgusting. Yeah. I'm really close to his head. You can see there's a lot of discharge, there's maggots present. Alongside that, it really smells. Whoa.
Wow, that goes down quite deep there.
Gosh. That is unbelievable.
Yeah. It's probably going down in towards his sinuses.
Yeah.
Fortunately, Val's found this quite soon, so it hasn't done too much damage.
It's all right, mate. Good lad. Good boy.
Right, I think we're give us a bit of a clean up and then give him some pain relief and some antibiotics. Hey man, make you feel a bit better.
I was very, very concerned and very, very anxious whilst he was being treated.
Ooh, no. No.
I'd be devastated if I lost him, because he does, literally, he means the world to me.
Do you think of those fine ingredients, Gordon Rammy? Is it going to sort you out? I reckon. Here we go. All right, be brave, mate.
And we want to try and dry up all the infection that's there, get that growth to shrink back and then try and seal off those holes so nothing can go back down into there.
It's all right, mate. Good boy, brave boy.
Scott really does have a great affinity with animals, and I've never seen that with Gordon, especially with somebody he hasn't met before.
Oh,
sorry, boy. As you can
little
tell.
shower there.
That connects down into his nose on this side.
Certainly does.
So,
got a nice snot shower there.
Yeah. Nice and spray. This is just some antibiotic spray to help with any infection. And then...
Hopefully that's your colour.
Nice silver. Helps with healing.
Looks great.
Yeah.
So antibiotic injection and then pain relief.
Yeah. You ready? Both of you?
I think so.
This one is...
Take it like a man.
Yeah.
Come on. Good boy.
There we are.
Good boy. Brave boy.
There we are.
How'd you go? Well done.
Good man.
Good boy.
That should make him feel a lot better. I was a bit dubious when I rang Scott as to whether his muscle factor would be advantageous for me.
I think about an hour or two, mate, you're going to feel much better.
But I think his allure to the animals was probably more than the muscles, to be honest. And I think his sweet whisperings in Gordon's ear helped.
So those drugs will start kicking in, you'll feel better. Back to your feisty self, eh?
It was really great to be involved. It was great to see Vicky at work.
Good boy, Gordo.
Good lad. And great to meet the wonderful Val. What an amazing woman.
Ah, he was a perfect gentleman in the end, wasn't he? Just like Gordon Ramsay, obsessed with food.
I'm back to pick Toots up after his operation. So, big smile on the face today.
Oh, are you feeling better? Hey? Are you feeling better? Oh, good boy. Should we go and see your mum? Hey, who's this then? Ah, who's this?
Oh, hello, baby.
Pleased to see you, I think.
Oh, hello, little man.
Oh, good boy.
Dear me. Oh, dear me. Oh.
You don't know how happy I am. No, it's a really good feeling. I can't stop smiling now that I've got him back.
You heavy little monkey.
I know, I think he's put on weight. He's done so well. He's really bright this morning. He's really happy.
Well.
Doesn't seem uncomfortable at all. So,
You're not going to talk to me, are you?
No.
It's all over and done with. Just want to get him home now and cuddles on the sofa tonight, and that's it.
Come on, there's a good boy. Going home now, aren't you? Yes, you are. Come on, dear sweetheart. Come on.
I've absolutely loved every minute of my time here in rural Wales.
He's got a lovely temperament.
Yeah, I can tell. That's an experience I haven't had in 17 years.
We'll make a farm vet of you yet, Scott.
The farm vets and nurses have just been so inspiring to work with. The animals, impressive and beautiful.
I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that.
Hello.
But I think it's been the wonderfully warm and resilient Welsh people and the fantastically beautiful landscapes that have captured my heart and made me think that I could make a go of it as a farm animal vet. But for now, I've got to get back to my family, back to the practices in Richmond, but I know I'll definitely be back.
This little cat has just been brought in
Hello, mate.
by a lady passing by.
Yeah.
She walked over with the dog, didn't try to get away, and quite happily let her pick it up. So she
Okay, that's
brought it
odd,
in.
isn't it? But that lady obviously is not the cat's owner.
No, she's not the owner.
So I can see a bit of bruising on the chin here. A little bit swollen, isn't it?
Yeah.
Let me just have a look in your mouth, mate. Yowza. Ooh. That's actually a fractured jaw right down the centre. So it looks like probably this cat has hit the ground hard, so probably jumped from something, out of something.
This would be quite an excruciatingly painful injury to suffer for this cat. It's always associated with trauma, so this cat would have hit its head hard and has snapped its jaw in half.
Now let's just have a look at your feet. Okay. Seems like it's breathing okay. She seems quite frightened. So no scuffing of the nails, are nice and clean, so she wasn't scrabbling up or down anything. Okay, well let's just scan her first of all and see if she's got a microchip.
Do you want to find your mummy or daddy, shall we? Oh dear.
Nope, no microchip. Well, that's going to make it more difficult to find your owner, isn't it? It's very disappointing to find out that this cat has not been microchipped, which is just so important for pets to be able to find their way back home to their loving owners. Okay, well let's have a little check over. Quite a quiet cat, so definitely it's gone through some type of trauma, I would say. Let's have a little listen. She's very still, she's very quiet, and she's got very dilated pupils, so it shows that she's in some level of shock. And cats in vet clinics don't tend to sit this still, so it's fairly classic of a cat that's gone through trauma and now is in shock. Should we be calling you a boy or a girl?
Yes.
Definitely a girl.
Oh, hello, darling.
A little bit sore over her hips there. She's just not happy about me feeling those.
So do you think she's fallen or something?
I think that's incredibly likely. She's got soreness in her limbs, she's got an injury to her face, and she doesn't have frayed nails, so she's likely leapt out of one of the buildings nearby and hit her head on the way down. We definitely are going to have to fix this jaw, but more importantly, we need to find out who owns you and loves you. Hey, you're an incredible looking girl. Look at those beautiful green eyes.
She's gorgeous. Oh, does that hurt? It's quite difficult when you get a stray cat that's brought in. Obviously, we have to act in the interest of the animal. I'm gonna wire it.
Yeah, I'm gonna have to.
Oh dear.
Okay, all right, bear with me a second. Scott, is that a stray cat?
Yeah.
I think I may have the owner on the phone.
No way.
Yeah.
Okay, awesome. Hello, it's Scott the vet here.
Oh, hi there, Scott. Have you got my cat?
We've got a black and white female cat.
Okay.
Beautiful green eyes.
Yeah. Sounds like, well, I call him a him, but how did he get to your vet?
He got scooped up by some lovely passers-by who noticed, I'm struggling to know if I say he or she, and they picked her up and brought her into the practice, so she's with us at the moment. So what do we call her? What's her name?
Well, I call him a him. His name's Bruce. He's really friendly. Is he okay, or?
She is fine. I think she's probably struggling more with her name than the injuries.
Oh, Bruce.
Having an owner who calls his girl cat a boy, even though it's actually a girl, is pretty confusing.
Can I just ask, why do you refer to her as a he?
Because when I wanted to get a cat, I was insisted I wanted a boy. But then when I seen him, I thought I had to have that one, and unfortunately, he was a female. But I called him my little man and everything.
The fact is that Bruce is my patient. She's had a hell of a fall this morning, and I do need to make sure she's okay, because to be honest, I just don't know how Joseph would cope without her. She has definitely suffered what seems to be a fall. Sadly, she's got a broken jaw.
Okay. I live like 2 stories above a restaurant, so
That's where she was
like
found.
From 3 floors up. The only way he could have got out was by jumping out the window.
3 stories. That's incredibly lucky. All right, mate. Well, look, I will look after your lovely Bruce, the girl, but we'll call him a boy so he doesn't get confused. And hopefully I look forward to meeting you shortly.
Okay, I'll see you soon.
Okay, Joseph. Take care.
Bye.
Bye.
Nice
Oh,
guy.
bless him.
Loves his cat.
Yeah, it sounded like he really panicked this
Your daddy
morning.
loves you.
You're too pretty to be called Brucey and a boy.
If I made up this story, no one would believe me. There's a cat that manages to survive jumping out of a 3rd floor window, then gets rescued and brought to the practice. The owner then reports to us that he calls his girl cat a boy. It's honestly unbelievable.
So what are we going to do then?
Well, the first thing we'll do is we'll treat Bruce for shock. So we'll pop him on a drip, her on a drip. Oh gosh, I'm not going to get that right, am I? When cats jump out of high-rise buildings, they, at lower levels, will try and right themselves and then land normally. But obviously at a height, they're going to injure themselves badly. They get everything from broken jaws to concussions, broken limbs, and damage to internal organs. The further up though, they go into free fall and then they actually relax. And because they relax, they don't injure themselves half as much as the ones that jump from lower down. So it's incredibly interesting, and it's called high-rise syndrome. Let's get us some pain relief. Can I for your daddy?
Good girl, Brucey.
Hi.
I rang up earlier. I think you've got my cat, Bruce.
You're Joe, aren't you?
Yeah.
Come with me.
When I woke up this morning, I was terrified. I just worked myself into a panic. I couldn't concentrate. I wasn't thinking. I was banging on the neighbours' doors. I just want to have him back in my arms.
Do you want to go in first?
Thank you.
I don't want to get in the way.
Oh.
Hi, Joseph.
Hi. Oh, got my baby. Hello.
Oh, he knows you.
What you got?
No, look.
Oh my God, you don't understand what it's been like without him. Bruce means absolutely everything to me. He's my absolute life. I cannot imagine life without him.
There's true love going on here, isn't it? I'm feeling very emotional.
I got him when I lived in Nottingham when I was 21. I literally did a Dick Whittington and picked my black and white cat up and just trotted down the M1 since me and Bruce started our life in London like 4.5 years ago. Just to think this morning that he wasn't there to continue this journey with me was devastating.
And the he thing is definitely something that's going to stay, is it?
Yeah.
That's something right.
Always.
Anatomically, apart from that...
Here's my little boy.
He's your little boy,
He's my
okay.
wounded soldier.
All right, all right. What we need to do now is some x-rays first, and then I'm going to wire his jaw, which I know is broken.
Okay.
All right, so be brave, be patient, all right? Grab a seat upstairs and we'll look after your little... Man. Man, okay.
Take care of him.
We will.
Thank you.
We will.
I'm just so worried about him, like, he's my baby. Just want him back home. Now.
Should we fix your face?
Sort you out.
Good boy.
All right then, sweetheart. Good puss. Sleepy time.
Go snoozy woozy.
I am so anxious, like literally I don't know whether to stand or walk. It's just not a nice feeling.
Oh, look at that, Jem.
Oh, blimey. That is nasty.
The two sides aren't together anymore and we need to make them together. Okay. So the way we're going to do that is by using a bit of wire. Just go around both the canines and then back under again.
It's a very big needle.
Yeah, it's not the most attractive
No.
of surgeries. There shouldn't be any reason why this cat wouldn't be able to eat. It's just all about holding that jaw together so it feels normal to eat. And what I need to do is now twist it tight to squeeze those two sides of the jaw together. As far as breaks go, for a cat that's jumped out of a window, I actually think this is a pretty lucky get out. Yes, of course, he has broken this part of his jaw, but breaks along the ramus, along the sort of arm of the mandible are way worse and way more painful. The mandible is the lower jaw, and the symphysis is where it joins in the middle, which is just basically where the chin is. And in Bruce's case, what we've got is that symphysis, that join, has broken apart, and the wire is all about sticking it back together again. That stays in place for maybe 4 or 6 weeks until the jaw's healed, and remove it, and Bruce will be back to normal.
I cannot wait for this to just be over. He's my everything, so I can't actually describe how much I want to see him again.
There you go, it's okay. Oh dear. No. What do you think of your new jaw, hey? Snort of satisfaction. Then we'll go and speak to your daddy, hey?
I have just been handed a letter of the person that actually found Bruce this morning. Dear Bruce's owner, my neighbour called me at 5:15 this morning to ask if I could help as she had found a cat she thought had been hit by a car. Having spent some hours with him, I have to say I've fallen in love with him. Oh, she calls him a him. So if you ever need a cat sitter, please don't hesitate to call me. All the very best. P.S. This is a copy of the poster my daughter threw together at 6 a.m. in an attempt to find you before you went to work. I'm just over the moon, I can't believe it. Bless her.
Where is he? Where is he? Hello. There you go.
Hello.
there's your, I'm going to say cat.
Oh, little boy. Oh, look at his leg.
It's just where the drip in. That's the least of his problems.
Is he okay?
He's doing great. He's got a little wire in his jaw just here. But otherwise, he's a very, very lucky cat.
I cannot believe I have finally got him back in my arms. Like I said, this morning when I woke up, I was in such a panic. I didn't think I'd ever see him again, but thanks to the fantastic people at the vets and such genuine, nice people in the world who found him, I finally got him back in my arms where he belongs.
I've missed him so much.
He's very lucky. He's used up about 12 of his 9 lives. He's a fighter, and it's a happy ending to this story, thankfully.
I'm so worried, Bruce.
Oh, you're all puffed out now, aren't you? All that playing? You sound like a snorting pig. There you go.
Sid is a very mischievous dog. His favourite thing is to try and get up the stairs when we leave the stair gate open and go searching for a love interest, which seems to be a big, cuddly penguin in my children's bedroom. He likes some alone time with that penguin. We kind of have to leave him to it and rescue the penguin a bit later. Growing up, I had English Bull Terriers as a childhood pet, and they've obviously got bowed noses and some breathing difficulties. But in the research that I'd done, I hadn't really counted on Sydney having such extensive problems. Come on. Obviously got a short nose, but I hadn't even realised that there was a problem with the mouth and the airway. Whee! Good boy. When you look at Sydney, he's such a gorgeous dog. He's so popular locally.
Sid! Sydney!
What people don't realise is that this dog is beset with problems.
All right, Sid. Okay, good boy, good boy. Go on then.
Playing with other dogs in the park, I have to pull him away after 5 minutes because he gets so overexcited he can't breathe.
Come on then, good boy. Good boy.
Sometimes he gets so bad I have to carry him home because he just can't catch his breath. It's really upsetting to see him getting distressed, and we know that he wants to run and play, and it really holds him back that he's just not being able to breathe and get the air down.
Good boy, Sid.
Dogs like Sydney can go into cardiac arrest because they can't breathe. So it is actually life-threatening, this condition. He's part of the family, and we'll do anything that we can do to make him better and give him the comfort he needs to get out there and enjoy the park. And we really need to get it sorted out quite quickly.
Oh, Sydney, you'll be better soon. Come on.
You know where we're going, don't you? Hey? Come on then. In we go. Good boy. Oh, that's a big sigh.
Hi, Joe.
Hi,
Hi,
Scott.
Sydney. Hello, mate. How are you? How are you? Hey? Oh, you're handsome.
He remembers you.
Come on in, Joe. Let's have a chat.
Brilliant, thank you. Yeah, I'm really worried about Sid. He's really struggling with breathing and just generally being a puppy in the park, and we need to get this sorted.
How's things been going, Joe? Still as snorty as ever, I'm guessing?
I'm afraid so, yeah.
So just to kind of go through some of the symptoms, he snores, I'm guessing?
Oh, yeah.
When he goes on a walk, does he pant pretty much the whole time?
Yeah.
Yeah. And does he pant for a long time after he recovers from exercise as well?
He does, and it exhausts him, so he falls asleep.
Yeah. Has he ever collapsed on a walk? Like, has he ever got to the point where he's so out of breath that he's gone down?
No, but he's been pretty close to it, and I've had to carry him home because he just can't get his breath and can't walk.
So he is classic of a lot of flat-faced brachycephalic dogs having this BOAS syndrome, so brachycephalic obstructive airway syndrome. Lots of big words there, but basically it means that because he's got a short nose and a big domed head, a lot of the structures in the back of the throat are excessive, and those affect his ability to breathe normally. I mean, it's great that he hasn't yet collapsed, but certainly that's where we're headed. And this kind of dog can become blue and purple. You know, they literally aren't getting enough oxygen into their system to be healthy, and then they can collapse. And look, worst case scenario, I have heard that they can die.
Oh.
So it isn't something that we can take lightly, and Sydney's a great dog, and we don't want to get to that point. Seeing Sydney today, it's fairly obvious what we need to do. We need to perform surgery. This isn't fun for him. This isn't a lifestyle that he can endure long term. We need to do something now, and the best option for him is to try and trim the soft palate and make his nostrils a bit bigger. What we're hoping from the surgery is that we're going to have a dog that's going to breathe much easier, is not going to be so stressed out in the summer, and hopefully won't snore as much and give you both a good night's sleep.
That would be good. I couldn't believe that when Scott said he needed surgery. I'm just devastated for Sydney, but also at the same time secretly quite pleased that it's actually going to get him sorted out.
Hey mate, we'll sort you out. Yes, we will. Yeah.
Let's go. Time for surgery. Come on, you're going to be much better after. Let's go. Come on then, in we go. Good boy.
Sydney, you're here. Hi. Hello, handsome. He's here for his nose job today.
Yeah, absolutely. Nose and soft palate. It's going to be awesome, isn't it, Sid? Bit of plastic surgery.
He loves your shoes, Al.
Look at these,
Look at
Sid.
Does he like it?
Oh, there you go.
So when Sydney gets overexcited, you can hear that snorting and snuffling that's, obviously really affecting him.
Come in here, Sid.
Look after
my
fur baby. I will.
Bye,
We'll give you a
darling.
call when he's woken up from the general anaesthetic. Oh, thank you. Oh, thank you.
Sydney having this operation is going to mean everything for us and him. Good boy. Mwah. And he's going to absolutely love getting out in that park. I know it for a fact.
Come on then, Sydney. Let's see Uncle Scott.
Hello, mate.
Hiya.
Hello, buddy.
Hi, buddy.
How you doing? You all right?
Yep.
Yeah. So your job is quite a challenging one today because here is a dog that has breathing problems. So I thought I'd do him a few drawings just so you girls can see what we're going to be doing. The soft palate looks a little bit like this. Okay. Gemma, you are going to be my surgical assistant today. All right. What we're going to be doing is I'm going to be putting two little sutures called stay sutures in there like that. You're going to be holding them behind my head.
Yeah.
And then I'm going to lock this bit off like
Wow.
that.
Okay.
But we have to be very careful. If it's too short, it just won't do anything.
Yeah.
And if it's too long, he can actually get consistent nasal infections. So I have to get it right.
Yep.
The second thing is the nostrils. This is the nose job that you're about to get, mate. What I need to do is to take two wedges out of either side of his nose, like that. And then I suture it back together. And what happens is by suturing it back together, it flares the nostrils open. And then he'll start having a much easier run when it comes to breathing.
Oh, you get to breathe again, Sydney. That's exciting.
Is that all right with you? Is that all right with you? All right, let's get to it.
Do it.
This particular syndrome of having the long, soft palate and really tiny nostrils can be life-threatening. Dogs can become cyanotic, which means that they have not enough oxygen getting into their system. They turn blue, and yes, they can die if that happens. Come on. Certainly Sydney is a dog that under anaesthetic will be compromised, so we all need to be sure that we know exactly what we're doing, that our roles are defined, and that everyone's on their top game. Straight away, look how much that soft palate goes into his larynx.
That's incredible.
So you can see it's actually hanging inside his voice box there. That's the problem. Soft palates in French bulldogs are always fairly sizable, but Sydney's is an absolute belter. It is huge. It really is. It looks like a second tongue. Great. Okay, let's move him into the surgery and get going. I do need to take quite a bit away from this to make sure I get the result I'm looking for. Right, so I'm just going to place the stay sutures now. All right. Yep. Ready to get close and personal?
Yes.
There you go.
Hug. I think this is the closest we've ever been.
I feel your
on your ear.
I feel your breath on my neck. I feel like it's more like an experience with a vampire or something.
What are you trying to say?
Gemma and I are good mates at work, but I don't think we've ever been quite that close. Oh, now all I can think about is your hot breath. That's not right, is it, Sydney? Hey? Okay, that's good. All right, so we're just about to cut now.
Wow.
There we go. So once we've trimmed back the soft palate, we have just got 2 edges that we need to suture together, and we do that very well. I'm happy with that. That's good. So, Jem, if you unhook there, thank you. Good. Let's embark on that nose job, shall we? Hey? The procedure on the nose is an interesting one because we're taking sections of the nostrils away to actually make the nostrils bigger. But anyone that's ever cut into a nose before will know it bleeds like hell. But very quickly you can control that just by suturing it into the right position, and straight away you could see that he had nostrils where he didn't have them before.
That's amazing, Scotty.
That's beautiful.
Like, all joking aside, like, I'm actually really impressed with what you've just done.
Well, that's one heck of a nose piercing.
Have we come up with the official name for this procedure?
Well, it's kind of akin to a rhinoplasty, but that's when people get the sort of the cartilage bit, the bridge reduced. So this is more of a narrowplasty.
Narrowplasty.
I could see Scotty as a plastic surgeon for humans.
Why?
The women would love you coming to get their noses done and their lips done and their boobs done.
You just imagine the consults, they'd be so different from this. You know, instead of being salivated on and attacked by the leg. It might be actually your
Oh dear, you went there, you went there.
Oh dear.
A lot of our clients like to come in and they think Scott's a dreamboat and they all fancy him. My auntie fancies him. So you can just imagine the clientele if he was a plastic surgeon. Women coming in for their lips to be pumped up and things like that.
I think it's perfect, isn't it?
It's a little bit perfect. You can hang your...
I know Gemma will say something rude if she doesn't think it is, so come and have a look.
Let's have a look. Inspect your work. So we do have to try and keep Scott's ego under control, but we did have to give him praise this time because it was a pretty good job. I think it's pretty perfect.
Wow, high praise.
I'm scared to say anything about it.
You should be, go away. You're perfect, Sydney. Good job. All right, let's wake this boy up, shall we? Straight away, as a surgeon, you can see and hear that Sydney's snuffling days are over. Do you want us to call Mummy, eh? Yeah. So everything's gone well.
I think we're all super happy with the result. I think in the long run, Sydney is going to be so much happier. We're going to be able to breathe better, going to be able just to enjoy life a little bit better. So here's to Sydney and his new nostrils.
I know, it's going to feel weird, isn't it?
Funny.
Hi!
How did it go?
Very good. He's been so lovely. He's been such a good boy.
Good recovery?
Yeah, really good recovery.
There you go with that new nose. Hey, looks good. Happy?
Without Sid at home today, it's been really quiet. Quiet in the fact that he's not running around under my feet, but also quiet because he's not been snorting and shuffling and snuffling in the background.
Come on, big boy. Here we go. Let's go find Mummy.
So it's going to be quite strange going home and him being there and still being silent, but knowing he's there.
Oh, here he comes!
Hello. Here's your boy with his new face.
Oh my gosh, Sid. Hello.
What do you think?
Hello, it looks amazing.
So the surgery went really well. We trimmed that soft palate, so hopefully he won't be gurgling as much. And then as you can see, he's got some, well, he's got nostrils. He didn't have them before.
They're excellent.
Yeah, I'm really happy. He's done really well and breathing quite quietly, really, considering he's still quite sleepy.
Yeah, that's excellent. Thanks, Scott. I think Sydney looks amazing. I can't believe the difference already in the nostril size.
With all the swelling reducing over the coming days, I think he's going to just get better and better and better. And hopefully then you'll be able to walk in the park, enjoy the great outdoors, even in hot weather, with a dog that isn't making so much of a racket.
Well, Sid, I can get you home.
You got him. All right, bye, champ. Bye, mate. Boy, nice nose, by the way.
Thanks, Scott.
See you, Jen.
soon.
All the best.
All right, take care.
Bye.
Bye. Come on, Sid.
See ya.
Bye.
Bye, Sid.
Say bye.
Bye, mate.
Bye.
You're so cute.
little jaw. He's got his beautiful smile all fixed again.
6 weeks after surgery.
Hey, is this the window you fell out of?
To have Bruce back home is beyond words unbelievable.
Are you happy to be home? Hey?
I'm just so happy to get him back, have everything behind us.
Are we going to stay away from them windows? We're going to be grounded.
I managed to speak to the lady that found Bruce. I took around a box of chocolates, a bunch of flowers and a bottle of wine. I cannot thank them enough for what they've done. Yeah, absolutely over the moon with them.
That's a good boy.
Hi, Sydney. Hello, mate. How are you? You're looking fantastic. Hi, Joe.
Hi. How are
Good
you?
to see you. Yeah, really well. Wow, he looks so handsome. Look
Doesn't
at that.
he? He looks amazing.
Look at that nose. Hey? I mean, even at rest, he made a racket, but when he was exercising, he would snort, he would snuffle, he would pant. It was all very distressing and far from normal. But now I know the surgery's been a success and he's a happier dog because he's a quieter dog. Oh, what's that sound I hear? The sound of silence.
Exactly. No snoring.
Yeah, so how's it been going? Obviously he's breathing a lot better.
Loads better. He's playing with dogs in the park. He's running. He's still a little bit panty, but then he's a French bulldog, and that's what French bulldogs do.
I mean, look, we're never going to fully fix this guy. At the end of the day, he's a French bulldog, built like a tank,
Yep.
with a flat face.
Yep.
He's never going to be a beautiful gazelle running after, you know, the wildebeest in the park. He is always going to have a short run before he's going to be a bit out of breath, but it's great to hear he's much more comfortable enjoying life.
Absolutely. It was the right call to do the operation.
That's good, isn't it? That's good to hear.
Yeah.
Hey?
Oh, Sid.
Oh, you big wuss. Hey? What a good boy. Did the nose job help with the ladies at all?
You ready? Go on then. Since the operation, he's now enjoying his dog life to the max.
Good boy.
And as a family, we can see a different change in him. He's really enjoying himself out and about. It was a massive bonus for all of us, him and us.
I first heard about Archie when a friend rang me up. She said she had a bulldog that needed a good home, and I said no. And then she said, but it's been in the rescue centre for 10 weeks now and it really needs a good home and you could look after it. So having buttered me up, I said yes.
Give us a kiss, go on. No, a proper one. Thank you. That was lovely.
When I first saw Archie, I thought, that is a big dog. That is big. When Archie came in the house, he did what most dogs would do that aren't used to being in a house, and he marked everywhere. And I realised that I was going to have a job on my hands.
Hello, my beautiful boy.
My house looked like a Chinese laundry. I had sheets hanging from the banisters, over the chairs, on frames. I had duvets drying. I think the hardest part was to take a dog, 2.5 years old, never been trained to live in a house. And so that a lot of effort went into getting him clean in the house.
How's that foot? Is it working today? Is it?
Archie came with lots of problems, lots of health problems. Apparently he had something wrong with his leg and he didn't want to walk. I took him to the park and all he wanted to do was to get back in the car. He wasn't interested in walking. I thought that was very strange. It was really bad. I felt responsible because I'd rescued him, so I was going to do the very best I could. I did this little step thing, you know, footstool, chair, bed, and he could get up a bit of steam and jump onto the bed, and he loved it. I did feel really sorry for him. He was coping, but I know that they're stoic dogs and that they'll cope with things that other dogs can't cope with. I knew I'd taken on something that I might not be able to cope with.
Let's go and say hello to the vet.
What's this?
Come on then, baby. Oh, good boy.
So Jess, what do we have on this afternoon?
Oh, we've got Archie in today.
Archie.
He's a good boy, isn't he?
Yeah, he's good. Have you met Archie before?
No, I don't believe I have.
Okay. Yeah, he's a good boy. Have you got him out of the car before?
No, I haven't.
I think it'll be good for your training.
Okay, we'll see how that goes then.
It's definitely your turn.
Okay.
Hi, Archie. Hi, boy.
Archie laid claim to the car. I think he must have lived in a car. It must have been his kennel, if you like, because he made it his own.
Come on.
And he didn't like other people, especially men, trying to get him out of the car.
Hey, Archie.
You all right?
Hey. Oh, it's an overwhelming feeling of dread. There's a serious risk of losing an arm. Come on. I think we need Scott.
Definitely.
Yes. Okay. So Jess and I looked at each other and we said, do you know what? We admit defeat. It's time for Scott. Neither of us are that brave. It's his practice, it's his arm.
Hey, Peggy. I hear he's performing, is he?
No, it's been lovely, Scott.
Oh, really? You being a right old grump. Come on then, you big wuss. When Jess and Ryan came in needing help, I wasn't surprised. It's not the first time, and it certainly won't be the last. Archie loves the car and is more than happy to tell people to go away in dog speak. Come on. No. Excuse me. Bad behaviour is not tolerated. Come on. Right. There we go. That was a bit naughty, wasn't it? Come on in, you old grump. Here we go. Come on. I first met Peggy and Archie in the clinic, and straight away I thought, this is an odd couple. Gee, he's walking like an old man in a young dog's body. Archie's a handful. There's no doubt about that. And it's not just the physical problems that he's got going on, but also the behavioural, the mental ones. But Peggy just wants to do the best for Archie, and I salute her for that. She's an absolute star. Peggy, I tell you what, I've never noticed Archie look quite that bad walking in. Has he really been struggling with walking of late?
He has been, and it's been deteriorating, which is the reason I brought him in today.
Yeah, bless him. And I tell you what, normally, when I've got him out of the car before, he's been the perfect gentleman. But I tell you what, today, he was about to rip my arm off. That's new. I absolutely love Archie. He is like having a bromance with a dog. He's this big, burly, blokey dog. He is such a character, and absolutely, I fell in love with him.
You're extra grumpy. It just shows you're extra sore, doesn't it, you poor boy? Let's have a little feel of those elbows.
Wow, they're feeling very, very thickened and actually quite swollen at the moment. Good boy. So what I'm feeling here, Peggy, is just a sort of feeling almost of nuts and bolts under the skin. Yes, there's little bits of bone that are rolling about in that joint. I always think of him as almost like a bodybuilder, you know, where they go, ooh, and they sort of, they pump up.
Yes, yes.
And he's sort of doing that at the front.
Yes.
And by doing so, he's sort of top-loading the front part of his body, and I think that's just wearing him out quicker than he should be. For a 3-year-old, I would never expect arthritis. Archie, yep. So what I think that we should be doing today is I will have your chap and I will be taking him downstairs. We'll be doing some x-rays and have a little look and see what's present in those joints.
Okay.
And then we can discuss a bit more about exactly what we're going to do about it.
Okay.
All right, mate, you're going to spend the day with your buddy, with me, hey? I'm going to see if we can get you walking better again.
Both Peggy and I are heartbroken to see Archie walking so uncomfortably, and certainly Peggy's living with us every day, so it's a tragic story if we do find that he does have arthritis. Good boy. Well done. Oh, there you go. Good lad. Oh, it's times like this I wish we invested in an elevator.
Hi, big boy.
Come on, it's like carrying a furry rhino.
Play ball, buddy. Boy. I'm going to bring out this leg.
Yep.
Perfect. Good boy.
Okay.
Good boy.
Everybody out.
Good boy.
And x-rays.
All right, so we'll just take this, the plate out of the way, and then Emma will just go and develop that. Good boy. Arthritis and 3-year-olds shouldn't be on the same page. You shouldn't think of them in the same sentence. Archie's a good boy. I really think we're going to see arthritis here. These are terrible elbows, and elbows of a dog far older than Archie is, so it's got to be a major problem, and it's certainly something that we need to do a lot about.
Oh,
He's chilled out a little bit now, hey? You relaxed?
I'm certainly warming into him more now.
Yeah.
He's a good boy.
He's a champ. He's just misunderstood, but he's grumpy for a very good reason, aren't you? Because you're just sore. It was great to see Ryan finally be able to see the good side of Archie, the happy side, the non-bitey side.
I forgive you. I do.
Whenever he's not in that car, he always acts beautifully, and he's a perfect gentleman for me. All right, Peggy, I've got your boy. Can't stop, he's heavy. You follow me in. There we go. In you come. Let's pop you down, big guy. There we go. If we can just close the door, please, that'd be great. And what's very clear is there's lots and lots of changes here. This is his elbow joint here. And what you can see is you can see these white bits of fluff. That's arthritic change. That's what's causing the problem. We've got new bone, we've got bone breaking down, building up all at the same time, and that's that nuts and bolts that I can hear and what I can feel when I flex and extend his elbow. The X-rays are concerning. Archie's just 3 years old, which works out to about 21 human years. It's like a young man, but with joints of a granddad. There's no drug that exists that's going to fix that. What we need to do is something quite brave, which is to go for arthroscopy. What arthroscopy is basically placing instruments into the joint to actually clean all those changes out of the joint. And I've got, luckily enough, a very, very good mate who is very good at arthroscopy, and I know that he's going to take very good care of you and Archie.
I think it's wonderful, I really do. It gives him another chance and a chance to get back on his feet, literally. Wonderful. I didn't think there was an operation. I thought this was how it was going to be and it would only get worse. So it was like another door opening, actually. I was absolutely delighted because now there's some hope for him. And quite honestly, I'd lost hope.
I've been so proud of the way that you've taken him on, warts and all, behavioural problems, physical problems, and still managed to keep a smile on your face and still managed to keep him under your roof. And now, hopefully with the surgery, it's going to make a massive difference, and hopefully we've gone some way into helping you on that road.
Oh, you have done that. You have done that. You've rescued the rescuer.
We definitely need some specialist advice here. My mate Michael Hamilton, specialist orthopaedic surgeon, fantastic in dealing with cases like this. So that's where I'm going to send Archie.
My friend Rod is going to take me to the surgery, and he's got a wonderful car, so we'll arrive like royalty, and that's what Archie likes. He likes to be a bit royal.
Right. Oh, what a little treasure. Here we are.
Getting round to the car was really easy this morning. We had no trouble at all.
Oh, what a good boy.
No temperament or anything. He just came out easily.
Hello, lovely to meet you both. So here he is, the big man. Hello, Archie. I've been hearing all about you. There we go. Right, come on in. Let's have a look.
Come on, we're going in.
Will he follow you in?
Yes, he will.
I don't fancy trying to pick him up.
He was apprehensive, I think, but then he could have picked that up from me because I'm feeling rather apprehensive about this treatment he's going to have.
OK, so just extension first of all. Ready, 1, 2, 3. Not too bothered. He's interested. And then this little specific test. Right, ready? Ready, 1, 2, 3. Hello, hello. Sorry, big man. I'm just going to do that again. Right, ready, 1, 2, 3. Oh. There we go. Oh, still friends. Still friends. There we go. I think that's quite conclusive, isn't it? OK. Well done, you. I got his elbow joint there, and I just kind of rubbed it, and I poked him right on that little spot there.
Yes.
And that little spot there, that little corner of bone, very commonly, is the bit that just sits a bit proud. So if this is his radius here, and this is the notch of his ulna here like that, that should be a perfect fit. If it's not a perfect fit, and that little corner of bone maybe sits a little bit proud like that, it can start to rub, or little bits can start to crack off. And when I poked in there, we got quite a reaction.
Yes.
For a bulldog, that's probably quite significant.
Yes, yes.
So this is a really, really frustrating disease to treat. There is no magic bullet. The point of today was to see where we are. The plan, put the camera in, see what we find. Based on what we find depends on what we do. But we're not going to be massively aggressive because we don't need him to start kind of, you know, catching the bad guys like the Met Police dogs need to do, kind of thing. We just need to get him out of pain, basically.
Just a bit stressed, that's all. And can't wait to get down the pub for a gin and tonic.
Come on in, Archie. Let's do this thing.
I hope that I'll be frolicking through the park soon. Yes, I do. With my dog, of course, not on my own.
Oh, look at that. Flying along. Come on, you. This way. This way. He's a good boy. I'll speak to you soon, Peggy.
OK.
Take care.
Yes.
Come on, then. Sleepy, sleepy. Hey. Relax.
Oh,
it's a hard bit, mate. So his elbow is a bit like an old person's knee, and if he was an old person, the doctors would be talking about things like knee replacement. For the time being, he doesn't need the big op. If we're not happy with him, we've got options. So this is the actual arthroscope, which is going to illuminate inside the joint. That's then transmitted to this thing, which is a camera, which then gets made into a picture of what we're going to see inside the joint.
Just to have a walk in the park will be wonderful, really wonderful.
Camera goes in. So now up on the TV is us inside the elbow joint. But my first impression, having just got the camera in, is this does not look very nice at all. All that red stuff there, that's inflammation of his joint capsule. He's got arthritis, he's had it for ages. That there, on the bottom of the screen, is red bone. So as soon as the camera went in, the first thing that you could see, red bone. What you want to see is white, shiny, articular cartilage. Straight away, red bone is not good news. That is his ulnar that I was hoping just to see a little crack in there. That's got no cartilage on it. This dog has got really, really severe cartilage erosion. That means that the less invasive options for him are not on the table anymore. The only options he's got surgically are pretty full-on procedures, cutting bones, plates and screws. We're going to try some medicine first. If it doesn't work and we're not happy, we don't want to leave him in pain. We've got options, but for now, no surgery. Success. Okay, all good?
Yeah.
Right, good. What we've done is we've taken a blood sample from him and we've treated it in such a way that we've collected these little things called platelets, which will release these little anti-inflammatory proteins, and we put those into the joint. Fill my landmarks again. And that will do nothing for the cartilage, but what it will do is it'll hopefully make the whole joint just less angry, less inflamed, and less painful. Done. And a happier dog, and a happy owner, and a happy vet. I don't know what Scott was moaning about. He's light as a feather. I could lift him with one arm. I don't know what Scott's banging on about. He's got significant loss of cartilage in his elbow joint. So it's not great news with regard to the cartilage that he's got.
Right.
So he's very, very much towards the end of the line in terms of his cartilage loss than at the start. So it was a bit of a nasty surprise we got, rather than a nice surprise. Okay? Now he doesn't know that though.
No.
Don't tell him.
No,
okay?
I won't. I'm not really surprised by the outcome. I didn't think we were going to get away with, you know, it being a simple affair. So, you know, so my reaction isn't, I'm not shocked or surprised. I thought that there was something pretty serious going on.
Here he comes. Here he comes.
Archie!
There you go,
baby. Oh, my little baby.
So he wins a little rosette for being brave. So the plasma injection, that will hopefully make him feel a whole lot better. For how long? How long's a piece of string? Hopefully long term. He's getting the cutting edge treatment. You know, this is kind of what they do in people. So Your job, difficult as it might, is try and get him as lean as you can.
Yes, I can do that. I will definitely
Sorry,
do
mate.
that. If you have to see him again, there'll be less of him to
Good
see.
stuff, good stuff.
Thank
Hey,
you
look,
very much.
All the best.
Thank
you
you,
take
Michael.
care of
Thank
each
you.
other. See you, Archie. We've had some pretty good results so far. If we can just get him to have his walk in the park with Peggy, that's what it's all about. And I would be optimistic we can get there. And if that needs surgery down the line, fair enough. But for now, all hope's on the plasma. So we'll see how we get on.
Look at that. He's walking better already.
So what a big day you've had, mate. So Michael's given me a call and he's told me it's sort of not brilliant news in that we've sort of somehow fallen a little short of what we'd hoped for today, which was to try and clean up the joint and have it perfect. In fact, the joint's quite a lot worse.
Yeah.
And now instead he's used this newfangled technique to try and give him some level of comfort. And it seems that we don't know how long that comfort's going to last for.
Yeah.
But it's a wait and see game. The injection that Michael gave is cutting edge. It's not something that is completely understood, so we really don't know what kind of result we're going to get with Archie. So obviously he's had the first big procedure, but doggy daycare is going to start now. We're going to be keeping in our mascot just as much as we possibly can to help you out.
Thank you.
When Peggy comes back from Michael, she's shattered, and so is Archie. And I think, you know what, she needs a bit of a break, and I'm there to help. So doggy daycare is offered up, and Peggy's keen to have it, and we're keen to have Archie. He's become part of the furniture now, a big hulking part of the furniture, and it gives Peggy a much needed rest. And let's just see how things go.
Wonderful. Yeah, I'm really pleased, delighted. It was like the raising of Lazarus because he just walked out really smoothly, and I've thought it was wonderful, absolutely.
When you're a busy vet, it's sometimes tough to have a nice quiet moment with your patients, and after a long day's work, what nicer than to sit down and have a good old cuddle with Archie. We had a bit of man time, bit of boy bonding. Oh buddy, what a big day you've had, hey? Yeah, you look knackered. Yeah, you do. But let's hope that miracle cure injection Michael's given is going to make all the difference, hey? The pressures of owning Archie, I think, are beginning to take their toll on Peggy. I think there's a very big chance that this is not the end of your story, my friend. It looks like there is a fairly significant surgery in his near future, and I'm worried that she isn't going to be able to cope, and Archie's future's uncertain. Good lad. Come on, Archie, bit of playtime now, mate. Come on, Archie. How are you?
Come on, buddy.
He's my boy. He's my boy.
Hello.
He's a boy.
Hello.
You gonna, hey?
Sit down.
I'm gonna rough you up. Hey? I'm gonna rough you up, hey? Yeah.
What?
I know. You're tackling me.
You've fallen in love with this dog a little bit, haven't you?
How could you not? Look at this guy. Look at this guy. Hey, look at this guy. Hey.
I think I love his face, which should really put most people off because it normally smells, but I love his little treats.
Archie has been really the life and soul of the practice for the last few weeks. He's such a character, he's got such a great nature, and that's been great fun to have him here and to have his sort of energy, so it's going to be really sad when he goes.
I don't know whether that's really sweet or whether that's
really
disgusting.
Don't care, do we, mate? Don't care.
Really have fallen in love with this guy. I'm really going to miss him.
No, he's such a character. He's just such a lovely dog.
Yeah, he really is.
Yeah, he'll certainly leave a big hole in the practice.
Massively so.
I've just had a phone call from Peggy and she sounds really upset. I don't know what's going on, but something's definitely happened. She doesn't even want to talk about it over the phone, so I'm just going to drive straight to her house now, check up on Archie and just see exactly what's going on.
That is very good. Wonderful.
I don't know what this plasma was or what it consists of, but it certainly worked for Archie. He's walking much, much better. It's not a permanent solution, but it's certainly making his life more comfortable. What a treasure you are.
Hey, Peggy, it's just Scott. Just let myself in.
Hello, Scott.
You all right? You
Yeah.
sounded pretty distressed on the phone. What's been going on?
Oh, lots. He bit me.
What? Where did he bite you? Show me. Oh, God, Peggy.
Well, he was having a sort of choking fit, and I got worried, and this was 1 o'clock in the morning. I got worried, and I just called the emergency vet, and the nurse arrived. She checked him over, did a marvellous job. He was very good, and she was going to take him in her car for observation for the night. And he snapped at her. I grabbed his head here and pulled him towards my right hand. He bit it. So really, I was trying to save her and didn't quite do it properly.
She's shown me a hand, it's swollen, and there's a couple of stitches in it. I mean, it's a dreadful thing to have happened. So, where does that leave us?
Well, I don't think that I can keep him, simply because I don't have control of him. It needs somebody stronger and younger than me to look after him.
Dogs get black banned as being aggressive as soon as they bite, and I'm someone who absolutely backs that up. In the case of Peggy, this was one situation where a stressed dog was being removed from a car that he felt safe and secure in, and he bit someone in a point of madness. I don't think that he meant to bite Peggy, but he did. I just absolutely love him, and I absolutely love you. You're such a force of nature, and so is he, and it's just, it's heartbreaking to see that this hasn't worked out.
I knew in my heart of hearts that I couldn't really keep him, but there is somebody who's the right owner for him in the right environment, and if you can find that for me, I will be eternally grateful.
I've never seen Peggy with glasses on before, and I know that it was her hiding from the world, hiding from me, and particularly hiding from Archie. And I could see behind the glasses that there were tears falling today.
I can't say... I don't know what to say. I love him to bits. I love you. I love you to bits, darling. Oh, thank you. I've got a kiss. Oh, you're going to go to a wonderful home. I know you are. I know you are. And somebody will love you as much as I do, darling. Yes, they will. Yes. Are you going to miss him too?
Grumpy old sod. I couldn't admire Peggy more, but today she's just gone to another level. She is a classic example of a great British female. She's got that stiff upper lip, she knows what needs to be done, and she's gonna do it. And it doesn't matter if it hurts her in the process. And today just proves what an extraordinary woman she is.
I've taken him from no chance to a good chance, and that's my reward. You know, I'm not a martyr. I just
You're a hero. You're a hero, Peggy. That's what you are. You're Archie's hero. Hey? I think the thing is with this guy is that we both love him enough that we need to let him go.
That's what real love is. Yeah. That's what real love is. I am very upset that he's going, but I know it's the right thing to do.
Do you want to follow me out to the car, or...?
No, I'd like to... No, I don't want to see him walking away from the house. I think I'll just say goodbye now. Well, in the garden. Yeah.
Say goodbye to Mummy.
Roly-poly, my little roly-poly boy. Aren't you?
She just couldn't face seeing him walk out of a house that last time, and it's very sad.
Bye-bye.
Okay, take care. Come on, mate, let's go. Good boy. Come on, mate. Good boy. Good boy. Come, let's go.
I didn't want him to look back. I wanted him to just go out, and he did it. You know, he's not going to miss me as much as I'll miss him.
Okay, come on, mate. Good boy. Sit. Let's go.
Oh, yes, I'm going to have a good old blub and a large gin and tonic.
Good boy. Gee, you're walking well, aren't you? Hey? Yes, you're walking well.
I know that Scott will find him a really good forever home. I know he will, because I know he cares about him almost as much as I do.
Good lad. So this is now my responsibility. What I need to find is someone who understands British Bulldogs. Up you get. Good lad. Up. 1, 2. This isn't a dangerous dog. This is a dog that we need to manage just purely getting in and out of vehicles. That's it. Well done. It's a Band-Aid treatment which will work, and I can ensure long-term that he doesn't injure anyone else. My friend, you have to watch your manners. It's nice that you worked on your bikini body at least. Yeah, well done. I've come to the beach today to just spend a little bit more time with Archie. He's been such a great dog. We spent such a lot of time together. All the nurses and the vets all love him. It's been a long journey, and now it's all about finding him a new home. But to do that, I've got to say goodbye, and so it's a pretty sad day. It's your last chance, my friend, okay? So take it with both big grubby paws, yeah? I'm gravely concerned that if he does bite someone again, then he will get put to sleep. He's a healthy dog now. He just needs to be a well-behaved dog, and then I'm sure he'll get us forever home. I'm really happy for Archie that he's found this new foster home, and I'm sure he's going to find a great home after this as well as forever home. Couple of bulldogs, Archie. I think we're here. Hello.
Hi, nice to meet you.
Nice to meet you as well. How you doing, Scott?
Yeah, really good.
Let me
How's the
introduce you.
journey?
Yeah, it was all right, thanks. Now look, this is Archie.
Yep.
He is my hairy tank. The first time I met Lou, I realised straight away she is a woman who absolutely loves bulldogs, and I knew that this was the place for Archie. Now I'm going to show you this, and I hope you won't judge.
Yeah.
He's obsessed with the car. He loves the car, and he's quite territorial of the car.
Doesn't like getting out.
That's it. But just that moment in time. The rest of the time, he's an absolute sweetheart.
Okay.
So, here's the chap. Say hi.
Hi, gorgeous.
You big handsome brute.
I just thought he was adorable. As soon as I saw him through the window, I was like, oh, bless him, he's absolutely gorgeous.
Come on then, mate. Out you come. Good boy. There we go. And then he comes out. Good boy. There you go. Getting Archie out of the car was always a little nerve-wracking, but thankfully he was the perfect gentleman. He didn't put Lou off at all. She seems completely unfazed by it. Already I'm feeling this is the place for Archie. Okay, so this is his new digs then.
Yeah, this is where Archie's going to be living.
Boy.
This is his little safe place. He's got obviously his bowl there. He will have a food bowl as well, but obviously this is his bed.
Bright pink water bowl. Lucky he's in touch with his feminine side, hey?
Definitely.
Archie's new home is perfect. It's flat, it is well set up, he's got a pink bowl. What bloke doesn't like a pink bowl? And he's got a gorgeous garden and an absolutely lovely foster mum. So I couldn't be happier. I think he's a very, very lucky lad.
There's so many bulldog experienced people on our site. You know, someone that understands the breed will do perfectly for him.
Yeah.
You know, he's quite a laid-back dog, so I don't think
you can tell that already.
Yeah. Yeah, because you do get some really manic bulldogs. But no, he just looks adorable. I think he'll fit in really, really well.
Oh, you just don't understand how much that means to me. It's so great that he's found a home with people that understand bulldogs.
Yeah.
And occasionally they're a bit grumpy, but it doesn't mean they're not
Definitely.
fabulous dogs.
Yeah. They're not always grumpy, they just look it sometimes.
Yeah, but don't we all?
Absolutely. But no, he is. He's absolutely gorgeous. I think he'll do really, really well.
Oh, thank you so much. Thanks
Not
for
a
looking
problem.
after my guy. I
You're
really, really
welcome.
appreciate it.
It's our pleasure.
I'm really happy that he's found you.
Yeah,
Thank
no, he's lovely. Archie's future's bright, I think. We're going to find him a lovely family. And there's loads of people that are out there waiting for a bulldog like Archie. I think he's going to do really, really well.
You have found one hell of a home here with your new mum, Lou. Now, you be a good boy, okay? Scotty loves you. And I'll see you soon. Okay, bye, mate. Mwah. See ya. This hip joint is no good. It's cactus.
What is the procedure now?
Sadly, the only way to fix this is surgery. I think it's a worthy gamble.
A worthy gamble.
The thing about Leo's hip replacement is he's tiny. There's very little room for error here. Wow. If we go too far, it's game over.
I hope Scott's gonna say your leg is alright. Is your leg gonna be alright?
I can see that when he's walking, he skips a bit, and I can see he lifts the left leg a lot, and he still kind of go up the sofa, he doesn't go down, and sometimes you can see he makes some noise. That is my concern now.
You're such a spoiled boy. I hope it's something minor, it's just a tick or something that he's got and it's nothing serious. I just can't imagine going through the stress of uncertainty. We're gonna give the mouse to Leo. We're gonna give the mouse to Leo.
In my heart started, beating and saying, no, please, no, don't be anything serious.
You know what you went through, hey? Oh, you don't want your brother to get sick, his as well, no. When I started seeing that Leo was limping, I thought to myself, oh gosh, we're gonna have to go through the whole surgery again. So Bella went into surgery and she was pining at the process of losing Oscar. So our friends all got together and decided they're gonna get Leo as a friend for Isabella just to boost up her morale. Leo, he's a ball of love. He filled a hole that we had in our heart, a big hole in our heart, and he's just precious, really precious dog. We just thought, oh my gosh, we're really unlucky to be in this situation again. But we have to sort this out because we can see he's not well. Fingers crossed, hopefully he'll come out of it without going through surgery or under the knife, because I can't imagine going through that whole procedure again, to tell the honest truth.
Now you're going to the vet, you're going to see the doctor, baby.
Yes.
Let's
We're
go.
going to the vet.
Look here,
Let's
baby.
go.
Isabella, do you remember where you are?
We're going to the vet.
You're going to see Scott.
Hello, good
How
to
are
see
you?
you. Very well, very well.
Hi,
Hello, Michael.
Scott.
Hello, pups.
Hello.
Hello, you two. Aren't they the most gorgeous couple? Aren't they?
Yes, they
Hey?
are.
Yin and yang. Hey?
Yes.
All right. Well, why don't you guys come on in? It's always great to see Michael and Anderson in the practice, but at the same time, you're always quite concerned as to what they're coming in for. They've had a huge amount of bad luck in the past with their animals who they adore, so I hope that it's not too serious this time around. So which one of this beautiful couple has come to see me today?
It's Leo.
It's Leo.
Oh, is that right? I know they're inseparable, but I think you've been through more than enough, haven't you, sweetheart? And she's looking great. She's been very healthy as well. She hasn't seen me for a while.
Amazing. Since she came from surgery, she's a different dog.
Gee, this guy has got some pressure on his shoulders. He's got to fill Oscar's shoes. And how's he been doing with that? Hello, mates.
He's been doing quite well.
Yeah?
The only thing, I don't know if it is a big concern, but sometimes when we play with him and we touch his leg, He sometimes cries, so I
All
don't
right.
know if
Okay.
that could be an issue.
Yeah. Has anything
So-
happened to him that made you worry that, you know, maybe it was an injury or?
No, nothing.
No?
It's just when he's walking or running, he quite often lifted leg.
It's like a
Then
little-
is my concern that something could be wrong.
One of the first things I can feel is that the leg on the left-hand side, the muscles there are smaller than the ones on the right. His hip now and just see what's going on there. Good boy. Oh, goodness. Oh, baby boy. So that's certainly where the sore bit is, isn't it, mate? Yeah, I can feel that the thigh muscle is definitely smaller than the right-hand side, and the discomfort is coming from his hip. So it's quite a obvious pain, and he seems to be quite painful. And even though he's not showing it at home, it might just mean that he is reducing the amount of jumping that he's doing, the running that he's doing. He's just being a quiet, sedentary little dog, and I know that they're quite keen on being cuddled and carried anyway. So, you know, that's probably hiding a lot of the symptoms from you. So, I think the most obvious thing for us to do today is try and take some pictures of the affected joint, which is, of course, in the form of x-rays.
The yelp wasn't good news, was it? And that's not very promising when you hear him scream like that. So something must be really seriously wrong with him for him to be in such pain.
It's pretty obvious that there is an issue there, and it's definitely something that we all need to understand. You guys, I know, have been through a lot already, so we just need to make sure that we're not missing anything and that we're doing all the right things for Leo. Okay? All right. Okay,
Look
buddy.
after our dog for us, please.
I will. Gonna stay with Uncle Scott today? You give daddies a kiss, all right?
Come little.
Leo's not yet a full-grown puppy yet. He's already got such a serious issue. It is a bit concerning for us.
All right then, I'll look after your chap and I will see you in a few hours' time.
Okay, thank you.
All right?
Okay, thank you.
Okay, bye guys. Bye Isabella. Say bye daddies. Say bye.
Okay, let's see your little Leo. Okay, there we are again. Hello again.
Hello again.
We had to see the results.
Indeed, the images are ready now, so
Oh,
if you'd like to go
wonderful.
on through.
Okay, well, thank you very much.
Okay, no problem.
Come on in, gents.
Hi, Scott, how are you?
Yeah,
Hello,
very
Scott.
good. Come on in. I'll give you back your boy. Be nice and gentle with him. Because unfortunately, I haven't got the greatest of news to deliver. You guys really know how to pick him. This guy has a condition called leg-calf Perthes disease. It's a mouthful, but it's a degenerative condition of his hip joint. All right. This is Leo on his back. This is his spine and his pelvis here. Now, on this side, you can see the whole section of that, the end of the femur, is a little bit longer. It's definitely abnormal. The shape isn't the classic ball. And what you can see is that big black dot in the middle there, which shows that already the femoral head is starting to collapse. It's starting to break down. And that's where the discomfort is coming from. Michael and Anson know me well enough to be able to read my face, and straight away they're anxious and upset. Sometimes life is just so cruel. So his hip joint is no good. It's cactus. It's such an extraordinary run of bad luck for these guys. They've had a dog that needed heart surgery. They've had a dog that was cruelly ripped from them as it got hit by a car. And now Leo has got a hip that's got some major problems with it. I mean, it's just so cruel.
What's the procedure now?
Sadly, the only way to fix this is surgery.
I think I wasn't expecting that at all.
No, it wasn't something we were expecting.
I thought something is small, we can sort it here now and then. And you have to go through the knife.
Well, there's two very clear options surgically. One is something that I can do, which is removal of the femoral head and neck. And what it leads to is a free floating leg, which sounds crazy because you think you've got to have a joint, but little dogs like this, they're very nimble, they're very light, and they can actually work very well with no hip joint. And it's the hip joint itself that's causing the pain in Leo, and that would be removed. The gold standard, however, is something called a total hip replacement. It is placing a false ball and a false socket into his hip and completely replacing the degenerate one that he's got. Now that's unfortunately not something that I can do. It's highly specialized, particularly in a little dog like him.
It's not very good news to hear that you have a little baby, such a small baby, has to go through it, unfortunately. And which, in your opinion, would be the better option then?
Well, guys, I'd say the gold standard, I think, is going and getting the total hip replacement. It's a massive surgery, but I think the benefits afterwards are considerable. And the fact that he is such a young dog and he's probably got a good 15 years to live, I think it's a worthy gamble.
A worthy gamble. I think we've got no choice but go for the better option.
Surgery again. Okay, yeah.
I think we're going to do the surgery, Scott.
To hear about a total hip replacement, they're very concerned, but I think they're also resolute. They want the best for Leo and they're willing to hold his little paw through it.
Now.
Now we have to see Mike. It's going to be a big surgery.
Oh, God.
Now, imagining the implant being so tiny and his bones being so small, and then cutting that bone of his to put that implant, it's a bit overwhelming. Leo, every time he sees a dog, he just explodes. Shush. It's like a little monster that comes out.
Hello, Leo. He seems pretty chipper, doesn't he?
Yes.
Relaxed about the whole thing?
He doesn't know what is coming up. That's what.
Come on in. Come on in. Small as he is, this left leg is a lot smaller than his right leg. He's lost quite a lot of muscle on that side as well, so which kind of fits with his problem.
Yeah.
Been on for a little while, so.
Because we've noticed when he's walking, so he lifts up his leg all the time.
Yeah, bless him. Okay, that's great. So if you just give him a little cuddle then, I'll just quickly talk you through what it is and what the plan is. So you have standard hip replacement, which is kind of Labradors, German Shepherds, that kind of thing, which is this kind of size, I guess. And then they developed micro hip replacement, and now they've got nano hip replacement. He's a nano. He's a nano total hip replacement. Yeah.
Oh shit.
The plan is that he's going to have a plastic on metal hip with no pain, with a normal range of motion, and he's going to be running around as a normal dog.
That's what we were hoping for.
That's the whole point. Let's go do a nano hip replacement.
Let's do
okay.
it, yes.
Right, follow me.
It's going to be really stressful until I get the call from Michael saying that the surgery's been all okay.
There you go. You want to give your daddy a kiss? There you go.
Good luck.
There we go. Right then, Michael. We'll speak later on.
All right.
Okay.
I'll
Right.
be waiting for
Okay.
your
Don't
call.
worry. We'll speak to you soon.
Thank you very much.
Come on then, you. Let's get you sorted out. Okay.
Always a funny thing to do, isn't it? There, Tickle. You're okay. There's a boy. He's okay. Good boy.
He's going to get an epidural for extra analgesia, but we're not going to put in as much local anaesthetic as we normally do because he might be a little bit wobbly after the procedure, which is exactly what we don't want when he's got his new hip in there. So we're just going to put a bit of morphine in there for analgesia. Now, some people would argue that this shouldn't be that painful, but I think if it was my hip, I'd probably rather have as much as I can get. So it's just the morphine with no local, and it's the local that would give him the wobbly legs. So, you know, want to keep him as comfortable as we possibly can do. The thing about Leo's hip replacement is he's tiny. There's very little room for error here. So the adrenaline right now is pumping.
X-rays. Take him.
The smallest one that they make, which is what we've got, is 10, and that measures 10. So it's a bit of a no-brainer in terms of selection of implant size. As expected, given these 2 kilos, it's the smallest one they make, and he's right on the edge. Right on the edge. Like I say, this measures 10, it's 10 millimeters. It's going to be on the wire. Right, we're going in. Leo's 2.7 kilograms. Smaller dogs have been done, but it's the socket that's the issue really more than the stem, because you could potentially doctor the implant a little bit with the stem, but not with the socket. So that's my big worry, is can we get a 10mm implant into a 10mm piece of bone with some cement at the same time. 11 scalpel.
Straight?
Yeah, okay, right, so we're off. It's not going to be very far in on this titchy little thing. So there you go. That's what we've cut off. So we've taken the femoral head and a little bit of the femoral neck here as well. The new femoral head looks a bit smaller. So this is grossly misshapen. It's almost went from a circle, which would have been a similar size to that. It's kind of shortened and flattened and kind of splurged out. It looks more like a mushroom. Flush and suction. For this dog, because it's so small and so delicate, we ain't going to be putting any reamers on power tools and press and go, because within half a second you could have no bone left. So that's not what we're going to do here. What we are going to do is we're going to use a little spinal burr, and we're going to use that a bit like a paintbrush and just remove the bone bit by bit by bit by bit, and just keep on seeing if our little trial 10mm implant will fit. And as soon as it fits, then we're good to go. Ooh, it's tight. It's really, really tight. So we just got to be very, very careful. The worry is we might run out of bone. If we go right the way to the sides, that's game over. This has to fit fairly soon, otherwise I'm not quite sure. We can file down the stem, but there's not really an awful lot you can do about the cup. There's no room for error. So if I remove not enough, it ain't gonna fit. If I remove too much, well, there's nothing for it to grip. It's important that I don't go through right the way through and out the other side. Yeah, it's getting it's like wafer thin now. I can't go any further, otherwise I'm gonna go through. So that's it. That's as far as we can go. Right, let's get the cement mixed. Go, 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 go. So, Claire, you need to get around here. We just got to now cement this thing in. So I just got to go for it now and hope it's good. Okay, so someone just count kind of 10 minutes or start the watch. If I move now as the cement starts to set, we're going to lose some of the bonding that we've got. But I think that looks from here quite good. Right. That's the socket there. If I move now as the cement starts to set, we're going to lose some of the bonding that we've got. But I think that looks from here quite good. Right. We're basically trying to make a hole inside the bone for this to fit with a little bit of cement around it. I can see this thing moving around inside the bone. Wow, that is getting really thin. If we go too far, we break the bone and we're a lot worse off than we were before we started. So yeah, that's a real kind of edge your seat time. Oh, not quite.
Tight.
Do you know what? I need another millimetre.
Oh.
Oh. This is so tight. So basically what I'm doing, I just keep putting this thing back in, because if this thing fits, we're good. And I think that actually is pretty good. We've got this implant now to fit, so this is it. We're just going to now cement this thing in. There's actually a very small window of when that cement is easy to work with and actually going to be effective to use. That you're going to put it in there and get your implant in, and then once you're happy, you've got to just stay put. Because if you start moving around as the cement starts to set, you're just going to debond the thing from the cement and it's just not going to work. Very careful. Right. So this is the actual implant. In she goes. And I need to just try and make sure that that is lined up.
She's in.
She's in. The fact that she's in is
good.
Is pretty damn good, I have to say. Whew. That, I think, is probably one of the fiddliest stops I've ever done. That feels pretty good. Let's go X-ray, see what it's like.
Yeah.
Okay. This is now the really stressful way for orthopaedic surgeons, because there's no hiding place on the X-rays, you know. I mean, worst case scenario, this hip might have popped out. That would be a total disaster, and I'll be crying. We need to get one of those. Let's go.
X-rays.
Fingers crossed. This view here is for us to assess the way that the stem sits in the middle of the femur, and it's really good. It's really good. It's in the middle. It's in for a start, so that makes me happy. Yeah, happy with that.
Oh, he's been such a brave little fella. We've got you a lovely soft bed for the night. There we go. He's so good. There we go. He's a good boy. Oh, it's all right. There's a good lad. There's a good boy.
One attempted jump onto the bed, and you know that hip could be not where it should be, and would be quite easy to snatch defeat from the jaws of victory here.
You got a new hip, mate. You're really lucky. Hey, he's a good boy.
Hey Maya, where's your friend Leo?
Yeah.
Where is he?
Yeah.
There he is. There he is, look, your little friend. Come on, you. 1, 2, 3. Oh. There we go, look. It's a bit of a one-off, to be honest with you, but he's the smallest hip replacement that we've done, and I just wanted to really keep a close eye on him for the first couple of days. Look, it's your little friend. Ah, gently. Ah, gently. My God, 2 babies to look after at the same time, crikey. He's had a major operation and he's got better extension and is less painful than he was pre-op already. So, you know, I'm really pleased. Go say hello to Maya. There we go. Are you going to miss him when he goes home? You're going to miss him? Oh. Right, off we go. Right then, One baby in. Ready to go. Yeah. There we go.
Hello.
Oh, there you go.
Oh, you chocolatey baby.
There you go. I had to bribe her with chocolate. She was getting tired.
Has she been all right?
Yeah, she's good.
Does she like Leo?
She loves Leo.
Oh. Come on then, you little one. Oh, good girl.
Oh,
Dad.
that's a bit more like
Did
it.
you help him
On
with
fight.
Leo?
Okay. See you later, Maya.
I'll see you later.
Excuse me. Hello,
sir.
Michael.
Hello, nice to meet you.
Nice to meet you.
How do you
Anderson.
do?
Oh, hello.
Okay, here he is. Here he
Hello.
is.
Can I? Sorry.
Easy does
come
it.
to daddy.
Easy
Come.
does it. There we go.
Come to daddy. Yeah.
He's missed
Yeah.
you.
This morning at 7 o'clock I was awake waiting for time to come here. I miss you so much, my little one. Yeah, you're going home now.
So he's been at our house the last 2 nights. You know, he's been getting waited on hand and foot. Anderson walks in and it's literally just, I'll see you later. It's quite funny. The most important thing is rest.
Okay.
And we don't want to be charging around off lead because if he does that, potentially things can move around and we can get a problem. If he's good at 6 weeks, I'll be pretty happy. And then as his exercise increases and he's off lead at 12 weeks, and I get a video of him flying around off lead, then I'll relax.
Okay,
All the
now.
best. Okay, you take
you very
care.
much.
Take it easy. See you, Leo.
Let's see Daddy and Isabella. Yeah, they are waiting for you. Yeah, they are waiting for you, my little. Let's go home. See, Isabella, where are you?
Big kisses today.
I first met Astro when the RSPCA were looking to foster cats out, so I said, that's great for me. I wasn't sure whether I was going back to Australia and it would be ideal.
So what's going on today? What's going on today, for goodness sake?
I went to meet him and he crawled up onto my lap and I said, well, you're the one. Straight away, he made himself at home. It was as if he'd lived here all his life. Astro was gorgeous straight from the start.
You're going to go and see Scott? Going to go and see Scott? Hey?
I think Astro has a massive sense of entitlement when it comes to Old Isleworth. He thinks he owns the place.
Astro.
He goes to the pub.
How's Astro today?
He's good. You come in for a drink? What would you like?
Saucer of milk for the cat?
He gets on buses.
He normally walks all the way down to the supermarket and he just thought, I'll catch the bus. And he sat on the priority seats for the elderly. Good boy. He's a good boy today.
As he goes and checks out the barber shop.
Astro,
He is extraordinary. I think this guy needs a key to the city.
you don't get a haircut today. Astro, come on. Astro, come off that sofa, please. Come on, babes, come on. Astro, come on, you don't live here. I've had cats all my life, but I've never had one like him. He loves to go to other people's houses, and inevitably I get a phone call saying, your cat is in my house. And this has happened all over Isleworth. And people just fell in love with him. It's ever so strange. Get on the bus?
Despite the fact that Astro seems to be getting around Old Isleworth perfectly well, he does have some issues that I'm concerned about.
Astro, come on.
His eye has got some issues and it has had for quite some time.
Come on.
In you come. Good boy.
Hi.
Come on.
Hey,
Hi, Astro.
Good boy. Hello, buddy. Hello, mate. How's it going?
You being a good boy? Hey, having a lovely day?
Whenever we see cats coming into the practice, they come in a cat basket. Sometimes, but rarely, they come in people's arms, but never do they stroll in by choice on their own.
He's so unusual. I heard he gets the bus.
He does. I hear a new story about him every time she comes in.
He's famous.
He's very famous.
Famous in Isleworth.
Come in and see Scott. He's not that bad. Come on. Go in and see Scott.
Come on, mate. In you come. You know where it is.
Come on, Astro.
Come on then, this way. Every time Astro comes into the practice, you can't help but smile. This is an extraordinary cat. Good boy. So, look, I haven't seen him for a little while, and I must say his eye isn't looking that great today, is it? Definitely has changed a little bit.
It weeps on and off, and that white bit has got larger. And one thing I noticed is he can't see very far away. Like if I go out of view, like, you know, maybe 20 feet, he can't see me, I don't think. And then I have to come closer, and then he recognises that I'm there.
Yeah, it definitely has changed a little bit. So Astro has had cat flu all his life, which is basically a herpes virus. And every now and again, when he's stressed, it comes out, causing injury to the surface of the eye, the cornea, and he gets corneal ulcers. These are chronic and ongoing, and as a result, his eye is scarred, and so that does mean it makes it more and more difficult for him to be able to see out of his eye. And he's now how old?
I think he's about 13.
Yeah, and he's obviously had herpes since a kitten.
Yeah, because he's had lots of flare-ups.
Yeah, so that's 13 years of flare-ups, 13 years of damage on that eye.
Yeah.
So first of all, just put a little bit of local anaesthetic into the eye just to make proceedings a little bit more comfortable. Hey, buddy, hey? Good boy. Good boy. I know.
I know, it's tough, isn't it?
It's only
Come
a
on.
couple of weeks. Oh, that's sweet.
Okay.
I know, come on.
He's fit up today. You are, aren't you?
Oh, I know. Your poor eyes. It's all right. I know. That little green dot there, can you see that, Louise? Right in the centre of the eye.
Oh, yes,
So unfortunately there is another ulcer present.
Oh, that's
so yet again more scar tissue for this poor eye. The concern I've got is that the changes that I can see on the surface of his eye might actually impede his independence. This cat needs to have 20/20 vision to be able to get around, and I'm really concerned that it's deteriorating of late. The eye is far from normal. Far from normal.
Oh, Astro, you've got herpes.
Mummy, don't say it so loudly, hey? We don't want all the neighbours to hear, do we? They won't let you in anymore.
Oh, babes. Astro's my little mate. He's adorable. I'd do anything for him. Yeah, he's a little treasure. So I'm worried something could be wrong with his vision. I'd hate him to have to lose his eye. Astro, what are we going to do if you can't go out, hey?
Today on examination of Astro's eyes, I can see that he has got some ulcers again, bless him, which are a little bit sore and of concern. Right now, I'm really worried that he could actually lose his sight. He's got a huge amount of attachments from the iris to the lens, and that is completely abnormal. So it's hard to know if that's because of this herpes virus or not.
I'm worried about Astro's eye and worried about what life he will have if he loses his eye. He loves to go out and wander. I don't want anything to hamper that. He's a good boy, hey? I think Astro would be miserable if he was confined to the flat because he loves to explore and he's got a big life and a big wide world out there that he loves to go out and see.
Louise, I know how much you love this cat and how much he means to you.
Yeah.
I mean, this cat really is one in a million. He is so special and he just deserves the best of care. We need to ensure that this guy keeps doing the extraordinary things that he does. The good news I can deliver is with the right management and time, we'll get on top of this corneal ulcer like we have before. But it is looking more and more abnormal. But I'm just really concerned that if his vision continues to deteriorate, it makes it more and more difficult for him to keep himself safe.
Do you think he can see out of it?
He can. You know what it'd be like? It would be like if you got your glasses, you took them off, you went, and you put them back on again.
Oh, so
it's like looking through mist. Yeah.
Oh, okay.
Yeah. So we can treat that, that's fine. We'll continue to do that. Yeah. The good news is that there is light getting into the back of the eye.
He loves life, he loves it. So I'd like to see him have it at its best.
Well, let's go and get the best for you, shall we?
Get me fixed.
Shall we get the best for you?
So I'm not quite speaking to you yet,
No.
Scott.
Hey?
Almost.
You're a bit mad at me, aren't you?
Yeah.
You're a bit mad. I couldn't believe it that even after a really long consult where I was annoying him and putting dye in his eye, that he still wanted to give me a bit of affection. He wanted to rub heads with me while sitting on the weigh scales. It might have looked like he was butting heads with me. He wasn't. This is definitely all bromance. And I can totally understand why everyone in Isleworth has totally fallen in love with this cat. Treating Astro is always fantastic fun. And at the end of doing it, he was a perfect gentleman. He sort of tipped his cap to me and then just decided to jump off the table and then saunter out of the clinic.
Astro.
Boy.
Boy.
All right, mate.
You ready to go home now?
You want to go home now?
Torch is over.
Hey, you want to go on the dog scales instead?
Come on.
Astro, he's a totally awesome cat. And for now, our intrepid explorer can continue to enjoy his jaunts around Isleworth. Long may he reign. Going to be our new window display. Yep.
And what would you like to drink today, huh? Milkshake, maybe? Hey, nice cocktail. What do you reckon?
Prawn cocktail.
Prawn cocktail crisps, yeah. Scampi fries, yeah. There we go.
I think he does. I think he's sharing himself. He's sharing the love with the whole neighbourhood. Everybody that knows him loves him.
So that's it for the day.
Just comes in for a mosey.
As long as the cat doesn't creep down in the night and help himself to my beer.
I don't know, he might actually. You like a drink, don't you, Astro? I'm looking after him, he looks after me, he's great company. He's just adorable. He means the world to me. I think perhaps it's destiny that maybe Astro and I are together.
It's not the thing you see every day, is it? Cats walking around in pubs. That's what he does. That's true. On another planet.
Leo.
Leo. Come on. Where's the ball?
Go, 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 go.
Leo. Where's the ball? Leo's doing really well and we're really happy with the outcome of the surgery. Fetch, 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 fetch. No more surgeries, no more nothing.
Touch wood.
Touch wood, yes. Because the thing is,
it's a bit too much.
For the last 2 years, it's been a living nightmare. And now, hopefully, it just be
just
happy
happiness,
days.
happy days.
Just happy days from now on.
Hopefully. Praise the Lord.
Hello there, gents. This is a happy scene. Good to see you.
Hello, puppies.
Hello. How are you, Leo? Leo is dancing away, chasing balls with Isabella. It's a massive difference from the last time I saw Leo.
Good boy.
Good boy.
Wow.
Where he was constantly lifting his leg up, he was in pain. But now Leo is walking comfortably and beautifully in the park. Okay, let's have a little look at him, shall we?
Yeah.
Hello, mate. Oh, that's good extension. It feels beautifully smooth, it's moving well, and all the muscles and support tissues around that hip are doing very well, so it's a really good result.
All happiness.
All happiness, no more surgery. Yes. Guys, agreed?
No more
It's a resounding yes.